Evening to each one of you. Myself, Dr. Vaibhav Jain, and today we will be doing the rapid revision of microbiology. Right? We are going to learn all the important things that can be asked in your examination. So this is going to be just a last minute thing that you would be looking at. Right? All I want is you guys to be interactive with me. Just try to answer whatever things I'm going to ask you. We have got multiple one-liners. I've tried to cap multiple keywords, right? For example, patient is having this, and now you have to identify the answer. I've kept multiple keywords for all the topics, right? Yeah, all the PYQs has been included here. Don't worry about PYQs. You just be with me for the next 2 to 3 hours, and that is going to be a very sound. Just a minute. Is there any issue with the sound to all of you? Sound is fine or not now? Let me know. Audio videos are fine. Can you hear me and see me? All good? All good. Can we proceed? Perfect, guys. Perfect. Right? All right. So we will be starting it off with the basics. What has been asked previously. We are going to start it off with the microscope, right? Who discovered microscope? Try to answer. Who discovered microscope? Microscope was discovered by Antony von Leeuwenhoek. He was the scientist who discovered the simple microscope, right? This is going to be the light microscope. Now try to tell me the power for light microscope and where we are going to keep the things. Okay, this is going to be the light microscope. Here is going to be the source of light. What is going to be the source of light, beta? The source of light in light microscope is going to be what? This is going to be transmitted light. This is going to be transmitted light, right? The power for scanner is going to be how much? Power for scanner is going to be 4x. Power for low power is going to be 10x, right? High power is going to be 40x. And if they ask you oil immersion field, this is going to increase the refractive index, leading to what? 100x. Another question they have asked previously, maximum magnification that you can get from a light microscope. The answer will be maximum magnification you can get from a light microscope. Answer will be 1000x. That is going to be the power of eyepiece. This is going to be known as eyepiece. Always remember, eyepiece will be having a power of 10x, right? If they ask you the power of scanner, what is going to be the power of scanner? Now the answer will be 40x, right? Because you are looking through the eyepiece and this is going to be the scanner. These lenses are known as objective lenses. These three lenses are known as objective lenses, and these three lenses we are looking at here, right? This is going to be the basic thing, right? Now next microscope we are having, this is your binocular microscope, binocular, right? And this one is your, what kind of microscopy we are having? What kind of microscopy? This is known as dark ground. Can you appreciate the background is dark? So this is known as dark ground microscopy. Dark ground microscopy. It is used for what organism? Example, it is used for what organism? Can you appreciate? This is a spiral like organism. So this is used for what? Spirochetes. This is used for very thin organisms or spirochetes. What are the spirochete example? They are giving you in the examination. They will write a question, a truck driver is coming to you, right? And the patient is having a painless ulcer. So what is that painless ulcer? That is going to be due to, that is known as syphilis, right? And syphilis is due to what organism, beta? Syphilis is due to Treponema pallidum. Syphilis is due to Treponema pallidum, right? So this is going to be the thing we are having, right? What is the source of light in dark ground microscopy? That is going to be reflected light, beta, reflected light, right? Reflected light is the source of light in dark ground microscopy, okay? The next one we are having is this particular one. This is known as electron microscope. This microscope is known as electron microscope, right? And try to tell me what is the fixation we are going to use for electron microscopy. What is the fixation for electron microscopy? What is the fixation we are going to use? That is going to be 2 to 2.5% of glutaraldehyde, which is also known as Sidex, and this Sidex solution we are going to use to sterilize the scopes, right? We have got multiple scopes. We are going to sterilize those scopes with the help of Sidex, right? This type of microscopy, what question they can ask you? This microscopy is known as fluorescent microscopy. Can you appreciate all these things are shining up, right? This is known as fluorescent microscopy, right? What are the questions they can ask you? What is the principle? The principle is it is going to convert the light of shorter wavelength. It is going to convert the light of shorter wavelength into the light of longer wavelength, right? Longer wavelength, right? And who is going to do that particular thing? That is going to be done with the help of a chemical, and this chemical is known as what? Fluorophore. That chemical is known as fluorophore, also known as the dye, right? So what are the dyes we are having for the fungus? The dye we are going to use for fungus is known as chalcoflower white. That is known as chalcoflower white, used for the fungus, right? For malaria we are going to use which dye? Very good. For malaria we are going to use acridine orange. For malaria we are going to use acridine orange. And for TB we are going to use which dye? That is going to be rhodamine or amine, right? We have done all those things very nicely in our full classes. So this is just a recap, right? So this is going to be rhodamine or amine, right? What are the two important things about phase contrast microscopy? Can you appreciate this particular area? This area is known as what? This is going to be your annular rings are going to be there, and here it has got what? Certain phase plates also, right? So annular ring is a feature of, phase plate is a feature of. Your answer is going to be what? Phase contrast microscopy. If they ask you dichroic mirror is a feature of, in question if you see emission filter, excitation filter, dichroic mirror, your answer will be what? These are the keywords you have to focus on. Emission filter, excitation filter, dichroic mirror. The source of light is going to be what? UV light that is coming from the xenon lamp, right? So all these things are going to go in the favor of fluorescent microscopy, right? So these are the different kind of microscopies we are having, and these microscopes are very, very important. Who discovered microscope? The answer will be Antony von Leeuwenhoek, right? Now we will discuss about the life cycle of a bacteria. So bacteria has got 4 type of things in a life cycle of a bacteria. These are the 4 phases, right? The first phase is going to be known as lag phase, second one is known as log phase, third one is stationary, and fourth phase is known as death phase, right? Maximum antibiotic effect you are going to get in which phase? Question is maximum antibiotic effect you are going to get in which phase, and antibiotic production is going to take place in which phase, right? So this is going to be a simple story of a bacteria. So first, bacteria, just like human beings, bacteria will also grow in size. First we are growing in size like 5 years, 7 years, 10 years, then we will get married, and after marriage you will be having what? Divisions, right? So the same thing will happen in the lag phase. The bacteria will increase in size. He is going to eat up the things, he is going to increase the size, right? It is going to prepare for the division. Second phase is going to be log phase, where you will be having rapid cell division is going to take place, right? This is the site where best antibiotic action you are going to get, right? So best antibiotic action, if they are going to ask you, the answer will be maximum antibiotic effect. The answer will be which phase, beta? The answer will be log phase. This is the expected question they can ask you. So what is going to be your answer in this particular case? You would be going with the log phase, right? The third question they are going to ask you is the antibiotic production. So in stationary phase, the number of death is equal to number of live cells, right? This is going to be growth rate is equal to death rate, right? After marriage what happens? Jeena marna ek hi baat hai, right? That is going to be the thing, right? In this particular phase you will be having what? You will be having stab. This is going to be a stab thing, है ना? दुनिया वालों ने धोखा दे दिया, stab कर दिया, right? So what is going to be the stab we are having? S4, first thing is going to be sporulation. First thing is going to be sporulation is going to take place in which phase? Stationary, right? They are going to ask you another question. Spores are heat resistant due to. Spores are heat resistant due to. What is going to be the thing which is going to make the spores heat resistant? Try to answer in the comment section, right? T4, we are going to have T4, toxin production is going to take place here. Toxin production, beta. A4, antibiotic production. A4, antibiotic production, and B for bacteriocin production. B for bacteriocin production, right? This bacteriocin is going to keep away all the other bacteria, right? That bacteriocin is responsible for what function? To remove other bacteria, right? If you have decrease in bacteriocin, you can have what? Decrease in bacteriocin lead to what? Which disease? You can have pseudomembranous colitis, right? If you are taking long-term antibiotics, third generation cephalosporin they are going to write you, or maybe clindamycin they are going to write you, right? And after that, what is going to happen? You are going to damage the bacterial flora of your GIT, and after that, what will happen? You will be having pseudomembranous colitis. Also, here on summarize, what is the drug of choice for pseudomembranous colitis? Pharmacology, try to answer. Let's summarize. Exam is so near. Drug of choice for pseudomembranous colitis, it is due to Clostridium difficile bacteria, right? And the drug of choice is going to be what? If they ask you the question drug of choice, your answer will be fidaxomicin beta. If they ask you the most effective drug, that is going to be vancomycin, and that is going to be used oral, right? If both the things are not working, you can go for fecal microbiota transplant also. Fecal microbiota transplant, that means you are going to transplant from someone else, right? So this is going to be the 4 phases we are having. Heat resistance is due to what? This answer is going to be dipicolinic acid. Dipicolinic acid, right? Dipicolinic acid is going to make it heat resistant, right? That is going to be the thing we are having. And lastly, this bacteria is going to die. That is going to be the death phase, right? So what is the special phases we are having? 4 phases. First lag, second one is log, third one is stationary phase, and the fourth one is going to be what? Fourth one is going to be your death phase, right? So this is the thing we are having. Now the next one we are having is about the stain. Stain means what, beta? Stain means giving the color, to bacteria. Sir, why to give color? Because sometimes we cannot see bacteria very nicely, right? So we need to give what? Color, so that we can see them very nicely under the microscope. The same thing is also known as what? Contrast. Sometimes you learn contrast, sometimes you call it stain, right? Funda remains the simple, right? Contrast is also like just giving the color. So we have got 4 types of stains. What are those 4 types of stains we are having? First is simple stain. Simple stain means same color you are going to give to all the bacteria. Like for example, we are using what? Methylene blue. If I'm using blue, that is going to give all bacteria what color? All bacteria will be blue. Now we can also use basic fusion. Fusion is going to give you which color, bacha? This is going to give you a red color. We can also use like cressyl violet, methyl violet, gentian violet. All of them are going to give you what? Single color. Like violet color is going to be there, right? Like methyl violet is going to be there, right? So all the bacteria are going to take up the same color. This is known as what? Simple stain beta, right? This is going to be example of what? Simple stain. Can you appreciate? Everything is appearing blue. This is going to be what? This is going to be a simple stain, not daptomycin beta. Daptomycin is something else we are going to use somewhere else, right? I'll teach you that thing also, right? The next thing is going to be what? Negative stain. Negative stain matlab kya hoga? Negative stain matlab we are going to stain the background now, right? This is your exam question. We are going to stain the background, and what bacteria or what capsule we are going to see more specifically? Your answer will be Cryptococcus neoformans. Cryptococcus neoformans, and the stain we are using is going to be what? Let me mark the PYQs with different color. This is going to be what? India ink or nigrosin stain we are going to use for what? Cryptococcus neoformans. Cryptococcus neoformans. In fact, this Cryptococcus is the most common cause for what? Exam question. This Cryptococcus is the most common cause for meningitis. Meningitis in which patient? In HIV positive individuals. HIV positive patient, meningitis symptoms, right? What are the symptoms of meningitis? Headache, nuchal rigidity, Kernig sign positive, Brudzinski positive, projectile vomiting. All these things are going to go in the favor of what? Cryptococcus neoformans. And the drug of choice for this Cryptococcus is going to be what? Try to answer. What is the drug of choice for this Cryptococcus neoformans, right? Third stain we are having is the impregnation method of staining beta. Impregnation method of staining means some bacteria are going to be very simple, very small, very thin, right? So what we are going to do, we are going to add on what? Silver. We are going to add on what? Mercury over them, so that they will become thicker. And if they will become thicker, they are easily visible. This is known as impregnation method of staining. This is known as impregnation method of staining. What we are going to do, we are going to add on what? Silver or mercury salts. What are the examples? For the tissue sample, we are going to use Livardity. We can also use for fluid samples, we can use what? Fontana. We have got examples like we are using Gomori methionine silver stain. Previous year question, last exam, they have given you one appearance on Gomori methionine silver stain, right? That appearance is known as ping pong ball appearance on Gomori methionine silver stain. What is going to be your diagnosis? That is going to be pneumocystis cerevisiae pneumonia, pneumocystis carinii pneumonia. It is in fact another case which you will be finding. If pneumonia is given in the question, Any patient, HIV positive patient with pneumonia, CD4 count is around 200, right? And also written like ping pong, crushed ping pong ball appearance. This is going to be what? This is going to be pneumocystis cerevisiae pneumonia, also known as pneumocystis carinii pneumonia. And the drug of choice for this particular thing is going to be what? Cotrimoxazole. Cotrimoxazole is the drug of choice. For this particular one, Cryptococcus neoformis, we can use what? Liposomal amphotericin B, liposomal amphotericin B. Along with that, we can also use what? Flucytosine. Very, very important stuff, right? Very important stuff has been asked previously, right? All this stuff, right? Most common cause of meningitis in HIV positive patient, your answer will be Cryptococcus neoformis, right? Another question they can ask you, most common cause for pneumonia in HIV positive individuals, your answer is going to be pneumocystis cerevisiae pneumonia, right? This is the third method of staining. This is known as impregnation method of staining, right? For Cryptococcus, you can also remember what is going to be the image they can ask you. This is going to be the image. This is a capsular fungus basically, right? So this is going to appear like this, right? This capsule is going to be visible. What kind of staining is this? This is your India ink staining of Cryptococcus. That means background we are staining, and now the capsule is going to come up and visible, right? This is going to be the CSF sample basically we are going to take, right? In the question, if you see CSF, when we are going to take CSF is cerebrospinal fluid. That means it is between the cerebrum and spine, right? So anytime you have symptoms of meningitis, always go for what? CSF. In the question, if it is written like CSF, you will always think in the terms of meningitis. This is what you need to remember, right? The fourth type of staining is known as what? Differential stain. So we have got four types of staining. First is simple stain, same color to all the bacteria is done. Second one is negative stain. That means background is staining and the organism will shine up. This is going to be India ink and nigrosin. Third method is impregnation method, where you are going to put something from the above so that bacteria will get thicker, right? What is the example? Like Gomorium methiomin silver stain. We are having Warthin starry silver stain. Where do we use Warthin starry silver stain? Another thing, right? That is used in H. pylori, which can cause cancers also, like gastric adenocarcinoma, maltoma, right? This is the thing, right? Last year question they have asked, what is the therapy we are going to use? Cap therapy. Cap therapy is what? Triple therapy. What is cap therapy? Just try to answer the form also if you can remember. So cap therapy is the triple therapy we can use. C for clarithrol, A for amoxicillin, and P for PPI is going to be there, right? You can also remember clarithrol, amoxi, and PPI. That is the thing we are having, right? Fourth staining is known as differential stain. In differential stain, we are going to do what? We are going to do four types of staining. First is gram staining, second one is Albert stain, third one is Zeden stain, and bipolar. Now we can differentiate between gram positive, gram negative. We can differentiate between different bacteria. So this is known as differential method of staining. So we have got how many methods of staining, beta? Four method of staining, right? Gram staining, the process they are asking, what is the mnemonic we are having? The mnemonic is methyl gas, right? So what are the things you are going to add on? First, you are going to take the sample. Primary color is always going to be what? Methyl violet or gentian violet. Remember, primary color is always going to be what? Violet or purple color. Then you are going to add on what? Fixator. This is going to be your G for grams iodine. Grams iodine for the fixation purpose, for the mordant. This is your exam question. They have asked it previously. What is a mordant or fixator used in gram staining? Your answer will be grams iodine, right? Third thing is going to be decolorizer. Here decolorizer is going to be what? Here you are going to use A for acetone you can use, or acid alcohol you can use. That is going to be decolorizer. And as for counter stain or secondary stain, second color, that is known as safranin, which is going to give you what? Pink color. Which is going to give you what? Pink color. If the bacteria is gram positive will appear what? Simple understanding, violet or purple color. Gram positive is going to be violet or purple color. Gram negative is going to be what? This is always going to be what? Pink in color, right? Pink in color. So this is going to be gram positive, gram negative, and staining, right? Staining means to give the color to the bacteria. Next thing we are having is about the all the culture medias. Next thing is about the all the culture medias, right? So what are the all the culture medias that you have to remember? This is going to be what? Staph aureus, we are going to use what? Ludlam's media. For pyogens, we can use what? CVBA. This is just a table you can see just before your examination. You can fetch 1 mark. Enterococcus is going to be bile esculin agar. Neisseria is going to be Thermartin media. Mycobacterium TB, this is your previous year exam question. Last exam they have asked you about this Mycobacterium TB. This is going to be your LJ media. What kind of colonies you are going to get? This is going to be your rough, tough and buff colonies. Rough, tough and buffy coat will be there, buff colonies, and eugonic growth or luxuriant growth will be there, right? For Bacillus anthracis, what is the culture media you are going to use? That is going to be what? Can you remember the appearance? Bacillus anthracis, try to tell me in the chat box. I'm waiting for that, right? Bacillus anthracis. Okay. Clostridium, we can use what? RCM. RCM can give you two type of species. We can have Clostridium tetani, we can have Clostridium perfringenesis. Clostridium perfringenesis. Remember, P for perfringenesis, P for pink color will be there. Tetani is going to convert this thing into black color. This thing will be converted into black color if tetani will be there, right? This is going to be what? RCM, Robertson cooked meat media. It will be having what? Cooked meat pieces are going to be there. If the color is changed into pink, this is Clostridium perfringenesis. If the color is changed into black, this is going to be Clostridium tetani. Okay. For diphtheria, we can use Loeffler's serum slope. We can also use for what other things we can use for this particular one? Try to answer, right? What is the other thing? Nocardia was your previous year question. Last exam they have asked in the NEET PG. They have asked what is the technique we are going to use to grow this nocardia. The answer will be what? Paraffin bait technique, beta. Very important. Paraffin bait technique, right? And this is going to be what? This is going to be a acid fast bacteria. How much acid fast, beta? 1%. Nocardia is going to be what? 1%. 5% is going to be lepra. 5% is lepra. 20 to 25 is going to be what? Mycobacterium TB. Mycobacterium TB. Remember the story of Lisa auntie. What is this Lisa auntie has to do, right? Lisa auntie went to which bazaar? That is going to be your Palkam bazaar, right? So Lisa or Listeria, the culture media is going to be what? Palkam agar. Palkam agar, right? For E. coli, we have got the question. E. coli, we can use what? We can use for E. coli, we can use clad or McConkey. Remember the last exam question they have asked you. I'm mentioning all the question. They have asked you McConkey is going to be differentiating between lactose fermenter and non-lactose fermenter, right? Remember the plant, right? So it is going to differentiate between lactose and non-lactose fermenters, right? So what are the lactose fermenter we are having? We are having E. coli, we are having Klebsiella, we are having late lactose fermenter, that is going to be Shigella soni, right? Others are going to be what? Not lactose fermenter, non-lactose fermenter, right? Who is going to be better? This is another question. Clad is going to be better than McConkey. Always remember, clad is going to be better than McConkey. What is clad? Cysteine, lactose, electrolyte deficient medias, right? For Shigella and Salmonella, remember Shigella, Salmonella always together. S for Shigella, S for Salmonella, S for selenite F growth is going to be there. As for selenite F growth. Vibrio cholera is going to be TCBS. TCBS is going to be there, right? For Pseudomonas, what is going to be your answer for Pseudomonas? Pseudomonas, the culture media, it is a nasty bacteria. It can grow in the disinfectant. What is the name of disinfectant? Beta answer will be cetrimide. Cetrimide agar. Pseudomonas, 2-3 things you have to remember if they ask you. Malignant otitis externa, diabetic patient with the malignant otitis externa, diabetes mellitus patients with malignant otitis externa, your answer will be what? Pseudomonas. Another patient, catheterized patient not getting well, this is going to be Pseudomonas. Ventilator associated pneumonia, this is going to be what? Pseudomonas or maybe Acinetobacter, right? Most probably Pseudomonas, right? Another thing, burn wound, very important. Burn wound patient with different colors, different colors. Maybe there will be green color or bluish color pigmentation will be there. Your answer will be what? Your answer will be Pseudomonas, beta. Very important, Pseudomonas, right? Bordetella pertussis, bordet gengu, they have given a question what kind of colonies you can have. You can have thumbprint colonies, right? Bordet gengu media, thumbprint colonies will be there. Legionella has been asked previously. This is going to cause what? Respiratory tract infection, right? This is going to cause what? Pneumonia in the patient. Legionella, what they will be writing you? Legionella, they will be writing you about a central AC, maybe some kind of a corporate company. They can also write you dirty water. Dirty water. And the patient is having what symptoms of pneumonia? Your answer will be what? Your answer will be Legionella. Your answer will be Legionnaire's pneumonia. Legionella will be your answer, right? Another question they can ask you, very very important. This is something examiners favorite. From last two 3 times they have been asking this question. This is your leptospira beta. Leptospira, EMJH, you can also use Kletcher, you can also use Korthorpe, right? But this is going to be leptospira. What is the thing you have to remember? The symptoms are going to be like dengue, but along with that you are also going to find a special symptom, that is going to be involvement of conjunctiva, right? So you will be having conjunctival suffusion. Conjunctival suffusion is going to be there in the question. Your answer will be what? Your answer will be leptospira, right? What about this mycoplasma? It is the most common cause for atypical pneumonia beta. This mycoplasma can cause what? Atypical pneumonia. What is the agar we are going to use? This is going to be Eton media or Paplo agar. What appearance you are going to get? This is going to be fried egg appearance. Where else you can get fried egg? Try to answer what are the 2 other places, like one in pathology, one in like mycology you have seen, where you will be getting the same fried egg appearance. Very good. Yes, here you will be having rat urine. Farmer is going to be there. Maybe paddy fields, they can write you. Rainy season, they can write you. This is going to be what? Leptospira, right? Campylobacter jejuni is going to be causing what? This is going to cause normally diarrhea, dysentery type of symptoms are going to be there. The media is going to be what? Sceromedia, you have to remember. The same scero you can also use for what? For the another bacter, that is going to be what? Helicobacter. And remember, this Campylobacter is associated with a disease that is known as Guillain-Barré syndrome, beta. Guillain-Barré syndrome, right? Very very important. After eating chicken or meat products, this person is going to have what? Guillain-Barré syndrome, and the drug of choice for this particular thing is going to be what? Intravenous immunoglobulins. This GBS is going to be ascending paralysis is going to be there in the patient, right? So this is going to be what? Campylobacter is going to be your answer. Okay. Another thing which can cause GBS is going to be another virus which can cause GBS is going to be what? Zika virus beta. Zika virus, right? So these are the 2 bacteria, 2 microorganism involved along with the Guillain-Barré syndrome. Guillain-Barré syndrome. Okay. So this is going to be about the culture medias that you have to remember, right? Culture medias. Right, the culture media for Bacillus anthracis is going to be what? Plate beta. Plate. Remember I told you the story. What was the story? There is going to be what? In Bacillus anthracis, which is going to be a category A bioterrorism agent, right? There you will be having what? There you will be having a miss will be there. Miss bamboo, remember? So M for Medusa head appearance was there, right? This is going to be Medusa head appearance. I for inverted fir tree appearance was there. S for she will be having a string of pearl appearance was there, right? And bamboo, she is going to have bamboo in her one hand. On the another hand, we have studied she will be having a plate, right? So plate was the culture media for Bacillus anthracis, and that is also going to have what? She is watching what? EPL. That is going to have edema factor, protective factor, lethal factor. We have seen that photo, right? So this is going to be what? Miss bamboo appearance beta. This is for the Bacillus anthracis, and the drug of choice was ciprofloxacin. Okay. All right. So next thing is about the motility beta. Motility is going to be what? Another question they have asked you from motility is going to be what? Tumbling motility is seen with what? Tumbling motility is seen with listeria beta. Listeria, right? Swarming is seen with, swarming is a feature of Proteus. Swarming का मतलब क्या होता है? छा जाना, spreading, right? So this is what is swarming. This is what is swarming. Can you see? Can you appreciate? It is spreading all around. This is known as swarming motility. Swarming. Darting, we have seen the mnemonic was VCD, V for Vibrio, C for Campylobacter, D for darting motility. Darting motility or shooting star has been asked previously. Shooting star or darting motility is seen with Vibrio cholera. Another question from physiology they have asked, Vibrio cholera. Cholera will be binding to which toxin? Sorry, cholera toxin will be binding where? So remember, this is binding to the GM1 ganglioside. Very very important, GM1 ganglioside. And more specifically, they have asked in the last NEET examination, where exactly in the GM1 ganglioside? The answer will be fragment B beta. Very important information. Fragment B of GM1 ganglioside is going to be the binding site for Vibrio cholera. Vibrio cholera leading to what kind of diarrhea? Very important. Try to answer. What kind of diarrhea you can appreciate with the Vibrio cholera? Next one is your Campylobacter jejuni. We have already seen this Campylobacter jejuni and pylori. These are the two organisms. One is living where? In the jejunum. Campylobacter jejuni, it is a microaerophile. It requires what? Little bit amount of oxygen, so that you got in the jejunum. Second one is going to be Campylobacter, and second one is going to be Helicobacter pylori, right? That is going to be living where? In the stomach and causing what? Ulcers. That is also a microaerophile. Some amount of air will be there, so they can survive better, right? This is the basic funda. Swarming is seen with the Proteus. We have seen the Proteus, right? Proteus can lead to what kind of stone formation? That is known as staghorn calculi, beta. All the important things I'm discussing here, staghorn calculi you can have with the Proteus, right? Another thing they can ask you, Proteus will cross react with the antibodies of what? With the rickettsial antibodies, and that test is known as what? That test is known as Weil-Felix test. Very important info, Weil-Felix test. And right, this Proteus will also give you fishy odor. Fishy odor can also be seen, right? So fishy odor can be seen at 3 places. One I have mentioned you right here. 2 others you have to tell me. Also you have to tell me about the fried egg appearance. Remember, 2 fried egg appearance you are going to find oligodendroglioma. In pathology you have studied about oligodendroglioma. And second fried egg appearance you are going to find on the SD agar when you are going to put that pityriasis versicolor, right? So on SDA subroad dextrose agar. On KOH mount you will find what? Spaghetti and meatball appearance. When you put the same thing into SDA agar, right, what you will be finding? You will be finding this fried egg appearance. Along with that you have to add on what? Olive oil, right? This is going to be the 2 other appearances. So mycoplasma, oligodendroglioma, and pityriasis versicolor. Simple, right? Next thing we are having is about the falling leaf life. That is going to be what? Falling leaf matlab gira diya. What gira diya? That is going to be giardia. Giardia is the most common cause for what? It is the most common cause for malabsorption parasitic we are having, right? This is going to cause malabsorption. How many pairs of flagella? Remember, giardia will be having total 8 flagellas are going to be there, so that is going to have 4 pairs of flagella, which can be treated by a single by the drugs like antiamoebic, like metronidazole is going to be good for this giardia. Corkscrew motility is seen with Treponema pallidum, which is going to cause what? Syphilis, right? We have seen the syphilis, right? Lashing, लाश को कैसे रखोगे? We can remember, लाश को रखेंगे बोरे में लपेट के. That is going to be Borrelia and Leptospira. बोरे में लपेट के, you can remember. T for twitching motility, T for Trichomonas vaginalis. Trichomonas vaginalis, you can remember, V is looking like 5. So how many flagellas are going to be there? So it is going to have 5 flagella, right? It is going to be a STD. It is your STD, and we need to treat the partner also. This is going to be Trichomonas. Roti कैसे बनाओगे? That is going to be rota. Rota is going to be what? Belen से. That is going to be Belentidium coli, which can cause what? Diarrhea. And the most important question they have asked is about the differential motility. Your answer will be what? Listeria. Anytime they ask you about differential motility, remember the Lisa auntie, right? This is going to be what? Listeria is going to be seen with the Listeria is going to have 2 types of motility. One is going to be, it is going to be motile at what age? When you are young, you drink outside, this is going to be what? Motile. You drink outside, you roam outside, this is going to be motile. When you are old, you are going to sit at home and then you are going to take this thing at home, this is going to become what? Non-motile. So when you become 37, you sit at home, right? This is going to be non-motile. So in body, this Listeria is going to be what? Non-motile. At 37 degree, it is going to become non-motile. At 22 to 25, it is going to become motile. Generally happening when a pregnant female is eating something out of the fridge, right? What can happen in that pregnant lady? She can have premature rupture of membrane. She can have neonatal sepsis also, right? This thing can happen, this which can lead to abortion in the ladies. So that is what is Listeria is important. That is why we always tell our patient, like who are pregnant, do not eat directly from the fridge, right? That is the funda behind this, right? So we have got this motility is also over, right? The next thing we are having is about the sterilization. Very important one question, definitely they are asking from the sterilization. No issues with the motility. Listeria is the favorite question of them, right? 5 pairs of 5 flagella is seen with the Trichomonas vaginalis, and this is going to have what? 4 pairs of flagella. This Trichomonas vaginalis is going to cause what, Peter? This is going to cause Trichomonas vaginalis is going to cause what? This is going to cause infection, which is going to have what? Discharge. What kind of discharge? What kind of discharge will be there? Two other entities which are also causing this kind of discharge. One is going to be what? Candida. One they can ask you is Candida, one they can ask you is bacterial vaginosis, right? These are the three causes for the vaginal discharge. Candida, remember, this is going to be intensely pruritic lesions, or intensely pruritic thing is going to be there, right? The person will be having intense itching will be there. Along with that, thick white curdy discharge will be there, right? Answer will be what? Drug of choice for this particular thing is going to be what? Drug of choice for this particular thing is going to be what? For bacterial vaginosis, they can ask you, they have asked in the last exam, they have asked about the clue cell beta. Clue cell, very important, the image of clue cell they have asked, right? What is the test we are going to do? We are going to do whiff test, and this is going to give you what kind of smell? This is going to give you fishy odor. Fishy odor is not so very common with this thing only, it can be seen in the trichomonas also, right? Okay, so you will be having what? This is going to cause what? This is also known as colpitis macularis, and this is going to known as what? Strawberry vagina or strawberry cervix. And what kind of discharge will be there? This is going to be green color discharge will be there, right? So this is how you can appreciate between these three things. Very, very important. Do not confuse. The first thing is going to be what? This is going to be Trichomonas vaginalis. Second thing is going to be Candida, and third thing is going to be bacterial vaginosis, right? The bacterial vaginosis is due to Gardnerella. Okay, this is due to Gardnerella. Okay, done. The next thing we are having is about the sterilization. What is sterilization? How many things we are having in the sterilization? Let's try to appreciate, right? So what are the methods of sterilization we are having? We can have physical and chemical methods of sterilization, right? In physical, normal method, in daily day-to-day life, we are going to put things on sunlight. This is a physical method. In heat, we have got two types of heat: dry heat as well as moist heat. Dry heat is going to be what? We can put the things on the flame, like we are heating something, like something we are heating. This is going to be a method of sterilization. What is sterilization and disinfection? What is the difference between sterilization and disinfection? Try to answer, right? Next thing we are having is incineration. What are incinerator? They are going to be very big machines in the hospital, right? And these big machines are going to be utilized for what? All the anatomical waste body organs, right? During COVID-19, all the organs or the bodies are going to be where? Into the incinerator. All the beddings, all the waste of the hospital, right? Whatever is there in the yellow bag. Where do you keep all those things? In the yellow bag, right? So whatever things are going to be there in the yellow bag, they are going to go into incinerator. What is the temperature for this incinerator? What is the temperature for this incinerator is going to be what? That is going to be 1200 degrees Celsius, right? Very high degree temperature is going to be there, right? So this is going to be what? Incinerator we are using, right? Second thing is going to be your hot air oven. Hot air oven we are going to use for all the glasswares, right? Your oils, your paraffins, your these things are going to go into greasy things, oily things are going to go into your hot air oven. They have asked the question, what is the temperature for hot air oven? This is going to be 160 degrees Celsius for 2 hours. This is going to be the temperature, 160 degrees Celsius for 2 hours. Instead of 2 hours, they have written what? 60 minutes in the question, right? We can also do the same, 120 minutes in the question. 160 degree, 120 minutes, right? We can also do the same thing for 170 degrees Celsius, 1 hour, right? This is also hot air oven. This is also hot air oven. Both the things can be used, right? Next thing is going to be about the heat, about the other method of sterilization. This is divided on the basis of temperature. We have got below 100, we have got above 100, and we have got at 100 degrees Celsius. So below 100 is going to be the first thing, which is going to be pasteurization. Remember beta, we have got two methods of pasteurization. First method is known as flash method. Another one is known as Holder's method. So on flash method, we are going to keep the temperature 72 degrees Celsius for 20 seconds, right? And then we are going to decrease the temperature from 72 to 13 till 4 degrees Celsius, right? So 13 till 4 degrees Celsius. This is going to be known as what? Flash method. This is going to kill everything. All the spores are also going to get killed. Whereas in Holder's method, you are going to keep the temperature 63 degrees Celsius for 30 minutes. This is not going to kill the spores. Like Coxella burnetii is also going to be there, right? And this thing can cause what? Coxella burnetii, remember, can cause culture negative endocarditis. I'll teach you about endocarditis, you will understand, right? So this is going to be what? Flash and Holder's method of pasteurization. This pasteurization, we are drinking milks every day, we are taking everything from the dairy product. These are pasteurized product, and this pasteurization was given by the scientist Louis Pasteur, right? Second thing is going to be what? Inspissation. Inspissation is done for two culture medias. What are those two culture medias, right? This is going to be your LSS, Loeffler serum slope, and second one is your LJ media. Remember, for both the culture media, we are going to do what? Inspissation. Inspissation. Because they are egg containing medias, we can do what? Inspissation. For all other medias, we are going to do what? Autoclaving. For all other medias, we are going to do what? Autoclaving. We can do at 100 degree, we can do boiling. If the same boiling is done like for 3 consecutive days, 3 दिन तक, this is known as what? Tyndallization. 3 दिन तक अगर you are going to do the same boiling for the next 3 consecutive days, this is known as what? Tyndallization. Boiling, remember, does not kill the spores. Tyndallization can kill the spores, right? More than 100 degrees Celsius is going to be autoclaving. Now the organism we are using as a control is Stereothermophilus. And what is the temperature beta? Temperature is going to be what? 121 degrees Celsius. What is the psi? That is going to be 15 psi. At what time is going to be what? 15 minutes. 15 minutes, 15 psi, 121 degrees Celsius. Your answer will be what? Autoclaving. Remember, beta, autoclaving can be done for all the organisms, for all the culture medias, right? Autoclaving can be done for what? Autoclaving can be done for all culture medias. All the culture medias can be done autoclave. Exceptions are going to be 2. What are those 2? They have been asked. This is going to be what? LSS and LJ media. This LSS is used for what? Diphtheria. Loeffler serum slope. This is used for diphtheria, can give you result within 6 to 8 hours. And this LJ media is used for TB, can give you result within 6 to 8 weeks. You can remember weeks, you can remember hours, right? So this is your inspissation, right? All the culture medias are going to undergo autoclaving. The exceptions are going to be to these 2, right? All the instruments, surgical instruments, your aprons, right, that you are going to wear in your OT, all these things are going to undergo what? Autoclaving, right? All the sutures, all suture materials, be it absorbable, non-absorbable, all sutures are going to undergo what? Autoclaving. The exception is going to be what? Exception is going to be catgut suture, but a catgut suture, right? Catgut is an absorbable suture or a non-absorbable suture? My question, try to answer. Catgut is a absorbable or non-absorbable suture, right? Sir, we cannot do like autoclaving for catgut. Then what we are going to do? Remember, we are going to use what? Ionizing radiation for catgut. For radiation, we have got 2 types of radiation: ionizing and non-ionizing radiation. Ionizing radiations are like X-rays. They can penetrate through your bodies, penetrate through your cells. This is going to be X-rays and gamma rays, and the catgut sutures are going to get sterilized with the help of this thing. All non-ionizing radiation, sound waves, radio waves, UV waves, microwaves, right? They are absorbable sutures, beta, right? For example, I'm doing what? Catgut. For example, I'm doing what? Let's say I'm making episiotomy here, right? After that, if I'm not having any sutures, what I can do? I can use catgut, right? I can use catgut. I can tie inside and I can left it inside. It will get absorbed automatically, right? This is going to be the thing. Next thing is going to be what? Radiations. We have seen the radiations. Then we can use earthenwares. Earthenwares are what? The pots, right? Matki, through which you are going to drink the water, right? We can have sintered glass. We can have membranes. Now, chemical method of sterilization is going to be what? Liquids and gases are going to be there. What are the liquids we can have? We can have alcohol. This is not the same alcohol you are thinking. This is isopropyl alcohol, which has got high quantity of alcohol. Isopropyl alcohol, also known as spirit, right? This spirit can be used for 2 purposes. What are the 2 purposes? One is going to be stethoscope, beta. Remember, all other scopes, glutaraldehyde. Stethoscope is going to be spirit. Second one is going to be your thermometer. Has been asked previously, thermometer and stethoscope, right? Aldehydes are going to be what? Your 2 to 2.5% glutaraldehyde, that is known as what? Glutaraldehyde, also known as Sidex. Your phenols are going to be there, like your Dettol, Lysol. These things are going to be what? Phenol derivatives. Your halogenated compounds are like your tincture of iodine, you have got povidone iodine, right? Povidone iodine, you have got what, betadine. All these things are going to be what, these are going to be the liquids, right? For gases, we have got what, formaldehyde gases, we have got ethylene dioxide, and we have got plasma sterilization. This plasma sterilization is your exam question. They have asked you what gas you are going to use, right? So we are going to use H2O2 molecules, and the answer will be H2O2, and they are going to produce what, free radicals. And remember, free radicals in the body, inside or outside, they are going to do what, always they are going to destruct whatever comes in their contact, right? So this is going to be the plasma sterilization we are having, right? This ethylene oxide is a toxic gas, we cannot use it directly, so less concentration of this thing will be used for the OT fumigation, right? So this is going to be the thing. One question they have asked you about, the intern is taking the blood sample, right? And this blood is going to get spilled in the like hospital. How you are going to clean that? Your answer will be 1% sodium hypochlorite. 1% sodium hypochlorite is going to be your answer, right? For the blood spills, we are going to use what, 1% sodium hypochlorite, right? So these are the things we are having from the sterilization. Very important, sterilization. The temperature they are asking for incinerator is going to be very high temperature. All the hospital waste materials, for glasswares, oils, paraffin, this is going to be what, hot air oven. Below 100 is going to be pasteurization. Below 100 is going to be what, inspissation. Very important. All culture medias are undergoing what, all culture media is undergoing autoclaving. The exception is going to be what, the exception is going to be LJ and LSS media, right? All instruments, aprons, all things are going to undergo autoclaving. This is going to have what, a pressure valve will be there, right? How you will identify, it will be having a pressure valve, pressure cooker like thing will be there, right? This is going to be present in your OTs, in your gynae, in your other department, surgery department. You will be finding this machine like thing, right? It will be very hot, 121 degrees Celsius, right? So this is how they are asking question. They have asked question on the blood spill. They have asked question here on the steroid, right? This is going to be the plasma sterilization, right? This much you have to remember for sterilization. Now we will talk about the food poisoning. We are going to discuss about the food poisoning, right? That is what we are going to get catgut suture we are going to get from the sheep gut, right? Catgut we are going to get from the sheep's gut, right? For the food poisoning, we are having what are going to be the symptoms. Food poisoning, or you can say gastroenteritis, will be there in the patient. Gastroenteritis will be there, right? So what are the organisms and what are the causative agent? They are going to give you big case, but the question will be having some keywords. If you get the keywords, your answer will be simple, right? So for Bacillus cereus, they are going to write you what, Chinese fried rice, beta. Chinese fried rice. In fact, this particular thing has also got two strains. One is going to be from the Chinese fried rice, another one is going to be what, meat and milk product, right? So this is going to be having incubation period of 1 to 6 hours. So if they give you question reheated Chinese fried rice in the history, your answer will be what, very important, very common. This is going to be Bacillus cereus. If they write you meat and milk product, beta, meat and milk product, this is going to be what, having the same incubation period of 1 to 6 hours. This is going to be what answer? The answer will be Staph aureus. The answer will be Staph aureus, right? Clostridium botulinum is going to be, Clostridium is anaerobic bacteria. What are anaerobic bacteria? Anaerobic example was Fuso, cannot breathe air. Fuso cannot breathe air, right? So these are the four anaerobic bacteria: Fusobacterium, Clostridium, bacteroids, and Actinomycetes, right? This is going to be the botulinum. This botulinum is going to be present where it does not need oxygen. So where do you have less amount of oxygen or no oxygen? This is going to be canned food, right? So in canned food poisoning, this is going to be Clostridium botulinum, right? Botulinum poisoning can be there, and it has got what toxin? The name of the toxin is C2 toxin, beta. Very important. All other food poisonings are going to cause diarrhea. All other food poisonings are going to have what? Food poisoning symptoms: vomiting, diarrhea, fever. But this food poisoning will be having different symptoms. What are the symptoms patient might land up into? Patient might have what? Diplopia. Patient is not able to speak. Patient can have dysphagia, right? Since it is going to deal with the neuromuscular junction, this is going to cause what? This is going to cause problems, right? So you can have constipation in the food poisoning. Answer will be what? Answer will be Clostridium botulism, right? Food poisoning causing constipation. This is going to be very specific to the Clostridium botulinum, right? Raw honey ingestion can lead to what? Floppy infant syndrome. Floppy infant syndrome. This thing can also enter through raw honey. Raw honey might have what? Clostridium botulinum things are going to be there. These spores are going to be there. This can lead to what? Floppy infant syndrome, also known as what happens in the baby. Baby will be having flaccid paralysis. Can anyone tell me what kind of lesion will be there? Upper motor neuron or lower motor neuron lesion will be there? Floppy infant syndrome, also known as this particular flaccid paralysis, right? What are the symptoms of food poisoning? Patient, they will be writing you, history should be there. How the stem of the question will be there? Just try to see the stem of the question. They will write you history. Along with that history, they will write you some symptoms are going to be there. Maybe patient is having what? Vomiting. Maybe patient is having what? Diarrhea. Maybe patient is having what? Fever, right? These are the symptoms you have to see with the abdominal pain, right? This is going to be the patient of what? Food poisoning. History is very important, and if you get the right history, you get your answer, right? Next thing is Clostridium perfringens going to cause what? Simple food poisoning due to reheated meat, right? They will write you that person has eaten what? Chicken from the fridge. It was like overnight chicken. This person is eating in the morning, and now the person is having what? Diarrhea and vomiting kind of situation. Food poisoning is going to be there, right? E. coli can lead to what? Undercooked meat. If you are eating E. coli, which strain? More specifically, very important, O157H7 is associated with hemorrhagic uremic syndrome also, and hemorrhagic colitis also. Very important information. This is going to be O157H7. Salmonella patient will be having what? Pea soup diarrhea. Salmonella patient will be having what? Pea soup diarrhea. It can be associated with the poultry, with the eggs, right? And this is due to dirty water also. This is going to be what? Salmonella, recent topic, right? Current situation, they can ask you in the examination. Salmonella is important. In fact, what else can happen in salmonella? Let me just give you a story, right? What is the pattern of fever this patient will be having? This patient will be having stepladder pattern of fever. So there is going to be a patient who is going to have what? Salmonella, and after salmonella it can lead to what? Typhoid. So typhoid will be having what? Stepladder pattern of fever will be there. Patient will be having rose spots in the question. They can write you. Patient can have Faggot sign, or patient can have relative bradycardia. You can remember this patient can have relative bradycardia. These are the symptoms, right? And this patient will be having what kind of diarrhea? Very important. This patient will be having pea soup diarrhea. And abdominal pain. It can lead to ulcers also, like typhoid ulcer. Typhoid will be having what? Longitudinal ulcer will be there, right? So this is going to be Salmonella typhi. Vibrio parahemolyticus is a halophile bacteria. This is going to be what? This is going to be associated with the seafood poisoning. Incubation period has been asked 16 to 24 hours. This is going to be what? Seafood poisoning. And Campylobacter jejuni, your last NEET PG question, Campylobacter jejuni associated with the poultry and milk product. In the question they have written milk product, and they have asked the question, very important question, they have asked the question, they have written milk product, but all of them are marking what? Milk. You see milk pastry, you see cake, you mark what? Therefore is. But also need to remember this is a gram negative bacteria. So in the question they have also written what? The bacteria is a gram negative bacteria. So your answer will change, and you need to mark what? You need to mark Campylobacter jejuni. Very important question, can be repeated, right? You understand this, right? This is going to be what? This is going to be Campylobacter jejuni, right? Next question they can ask you about is the urinary tract infection. What are the things UTI will be having? Patient will be having what? Fever can be there. Patient can have burning micturition. They can write you burning micturition. They can write you increase in urgency, increase in the frequency, increase in the frequency. They can write you multiple time this person is going for urination, and the same problem is going to be there, right? This is going to be what? This is going to be a case of urinary tract infection. The first question they can ask you, most common cause of UTI, everybody knows this. The answer will be what? E. coli. The answer will be what? E. coli, right? And what is the sample you are going to take, and how you are going to put that sample? You are going to take midstream urine, you are going to put it into McConkey, and for antibiotic susceptibility testing. For AST, what is the agar we are using, and what is the name of the disc diffusion test we are doing? DDT. What DDT we are doing, and how you are going to assess this antibiotic susceptibility testing? Try to answer. Another question they can ask you, gram positive cocci. In the question, if they write you most common gram positive cause for UTI and a young sexually active female, the answer will be changing. Now the answer will be what? The answer will be Staph saprophyticus. Examiner's favorite nowadays, they are asking question around Staph saprophyticus. Remember, saprophyticus and two species are going to be there, epidermidis. Right? So what is the mnemonic you have to remember? Need not to take any stress. This is going to be no stress. Right? They will ask you which one is novobicin sensitive, which one is novobicin resistant. Sensitive and resistant. Try to answer which one is sensitive, which one is resistant. So novobicin resistant is going to be what? Staph saprophyticus. Remember, so Staph saprophyticus is going to be novobicin resistant. Sensitive is going to be what? Epidermidis. Klebsiella can cause large mucoid colonies, right? Enterococcus can cause what kind of infection? This is going to be nosocomial type of UTI, drug resistant nosocomial UTI. Protease can produce urease, and this thing can lead to what? Staghorn calculi. Staghorn calculi. Can anyone tell me they are radio opaque or radiolucent? Staghorn calculi are going to be radio opaque or radiolucent. Means they are going to appear white on X-ray, or they are not going to get appear in the X-rays. Okay. Pseudomonas aeruginosa, very important. It is a drug resistant entity. Someone is immunocompromised. Maybe the patient is having cancer, maybe the patient is having diabetes, maybe the patient is having HIV. You are catheterizing that patient. The patient will be coming back to you with the same symptoms, right? Symptoms of UTI. You are using conventional antibiotics, but patient is not getting fine. This is a direct case of what? Pseudomonas aeruginosa. This patient will be having what? Pseudomonas aeruginosa infection, right? This is going to be the entity you have to remember. Always rule out this one. Okay. Now, how to differentiate the test you are going to do? Antibiotic susceptibility test you are going to do in an agar. That agar is known as Muller-Hinton agar, beta. Muller-Hinton agar. And the name of the test is Kirby-Boyer disc diffusion testing. Kirby-Boyer disc diffusion test. Disc diffusion test. Remember, here we cannot identify the dose, right? But we can identify whether which drug is susceptible, which drug is resistant, right? The next thing is about the streptococcus. How to differentiate the streptococcus? So we are differentiating. Strepto means beta chain. Strepto means chain, right? And cocci means round. Cocci means round. So this is going to be a round bacteria in the chains. So we have got three types of streptococcus on the basis of hemolysis. Hemolysis, right? So this is your hemolysis. This agar is known as what? Blood agar. This agar that you can appreciate, solidifying agent, this is known as blood agar. So when you are going to make a line here, you are going to identify what kind of hemolysis we are seeing. So here you can appreciate complete hemolysis. Here you can appreciate partial hemolysis. Here you can appreciate no hemolysis, right? So complete hemolysis means what? Complete hemolysis, beta hemolysis. Partial को बोलते हैं, partial we are going to call alpha hemolysis, and no hemolysis is known as what? Gamma hemolysis, right? So on the basis of this hemolysis, we are dividing this bacteria. Alpha hemolytic bacteria can be pneumococcus. Pneumococcus, it can be viridans. Alpha hemolytic can be pneumococcus, it can be viridans, right? Pneumo mein you have to remember, it is the most common cause for what? Pneumonia. Most common cause of pneumonia, community acquired pneumonia. Answer will be pneumococcus. Most common cause for meningitis, your answer will be pneumococcus. It can cause what? Sinusitis. It can cause what? Conjunctivitis, sticky eye that you are having, right? So this is going to be what? Pneumococcus, right? It is a diplococci. Diplococci means two bacteria are living together. This is known as diplococci, right? What is the test you are going to do? Pneumo is a capsulated bacteria. Pneumo, the test you are going to do is concerned with the lung. So this is going to be Q lung reaction you are going to do. And on chocolate agar, this is chocolate. This is the chocolate agar. That means reheated blood. This is on this particular agar, you are going to get what? Carum coin appearance or Trotman-like colonies, right? This is going to be the pneumo, right? Pneumococcus viridans is going to be something which is going to cause what? Subacute bacterial endocarditis. After a dental infection, after a dental surgery, this patient can have what? Subacute bacterial endocarditis. Sir, how to remember? What kind of question they are going to ask you? They are going to give you a big question. Very important concept here. They are going to give you a big question. There you will be finding the keywords. What are the keywords? First thing you need to identify the bacteria. They are going to write a patient is having that disease and the bacteria is alpha hemolytic bacteria. You have to come to narrow down your diagnosis to pneumococcus and viridans. Second hint they are going to give you is about optochin sensitivity. So they can write you the bacteria is optochin sensitive or resistant, right? If it is sensitive, you can remember the mnemonic overpass, right? If it is sensitive, this is going to be what? This is going to be pneumococcus. If it is resistant, this is going to be viridans. So they can write you optochin sensitive bacteria, your answer will be what? Pneumococcus. They can write you optochin resistant bacteria, your answer will be viridans. This is how you need to remember overpass, right? On the basis of optochin sensitivity. Optochin is what? Optochin is an antibiotic, right? Okay, so beta hemolytic, we are always discussing beta hemolytic group A, beta hemolytic streptococci group B. So what is this group A streptococci, group B streptococci? Means they are causing what? Complete hemolysis. That is why it is known as beta hemolytic, right? Now we can have two entities here. We can have streptococcus pyogenes, streptococcus agalacti. Remember, pyo are pus producing bacteria and pus is going to have two entities, very important. One is going to be suppurative complications and non-suppurative. Suppurative means pus like complications. So you can have most common cause for impetigo. Your answer will be what? Your answer, if they ask you most common cause for impetigo or non-bullous impetigo, the answer will be what? This is going to be streptococcus pyogenes. They can ask you most common cause of pharyngitis. Your answer will be what? Streptococcus pyogenes is going to be the cause for pharyngitis, also known as group A streptococci. Remember, pyo are B positive and PR positive. Remember like that. So pyogen is going to be bacitracin sensitive. B matlab bacitracin sensitive and PYR sensitive, right? Whereas this agalacti is going to be resistant to the same, right? Agalacti is going to be CAMP positive and HHT positive. This is going to be the agalacti, right? Some non-suppurative complications are going to be your acute rheumatic fever and acute glomerulonephritis. Rheumatic fever and glomerulonephritis. It can also lead to what? Quinsy. What is quinsy? Quinsy is going to be paratonsillar abscess, beta. This is a paratonsillar. Around the tonsil, can you appreciate the abscess? This is known as paratonsillar abscess, also known as what? Quinsy. Also known as what? Quinsy. Right? Acute rheumatic fever. What is the criteria you are going to follow for ARF? The criteria you are following for ARF is known as modified Jones criteria. Modified Jones criteria we are following for the acute rheumatic fever. For gamma hemolytic, you just need to remember 6.5% of NaCl, bile, no hemolysis, and VRE. These are the terms you have to remember. You can identify what? Gamma hemolytic bacteria. So this is how we are differentiating alpha hemolytic, beta hemolytic, gamma hemolytic bacteria. Right? These three are very, very important. They are causing major problems, right, in the gram-positive segment. Now, another question they can ask you is about the meningitis. What they can ask you about meningitis? They will write you simple story. What is the story they are going to write you about meningitis? Patient will be having what? Headache. Patient will be having fever, high grade fever can be there. Patient can have nuchal rigidity. Patient can have some sign positive, Kernig sign positive, Brzezinski sign positive, projectile vomiting can be there, right? All these symptoms are the symptoms of what? All these things are the symptoms of meningitis. Projectile vomiting. So what is this meningitis that can happen? You can simply remember we have got three layers. We have got dura mater, arachnoid mater, pia mater, and then brain parenchyma, right? So if you have anything, inflammation of these layers, these layers are known as meninges, and inflammation of these layers is known as what? Meningitis. Okay, above this layer you will be having what? Your skull will be there. Skull bone, skin, this is going to be the arrangement, and this brain parenchyma will be having what? Sulci and gyri will be there, right? So anything happening here is going to be sulcus and gyri. So this is going to be the basic understanding. If you have inflammation of this brain parenchyma, this is known as what? Encephalitis. This is known as encephalitis. Anything above is known as meningitis. Here inflammation is known as what? Encephalitis. You can also remember here, if you understand the anatomy, here you can have space. This space will be having EDH. What is the appearance? We can quickly summarize. Here you have space below the dura. This is known as subdural space. Here you have space below the arachnoid, subarachnoid space, and between these two things there will be no space will be there. So you can have EDH, SDH, and SH also you can remember from here, right? This is going to be what? Same thing. Now we cannot open all the things to look for the meningitis, so we are going to take out a sample, and this sample is always going to be what? Cerebrospinal fluid. The site for lumbar puncture is going to be what? Try to answer. What is the site for lumbar puncture? What is the site for withdrawal of CSF? Lumbar puncture site. So you are going to do the lumbar puncture, you are going to take out the CSF, and then you are going to look inside the CSF. What is going to be the thing? Very good. Yes, EDH will be having, this is going to be idli shape. This is going to have what? Lucid interval, right? Middle meningeal artery is going to get ruptured. Pterion is the site. And what is the treatment you are going to do? This is going to be burr hole surgery. Very, very important. Let me quickly summarize. These are the important points you have to remember. SDH is going to be what? Below the dura. This is going to be what? Here, what is going to be the site which is going to get ruptured, and what are the things you are going to have, right? And what is going to be in the SH, what they are going to write you, very, very important. This is the venous hemorrhage we are going to have. This is the only venous hemorrhage we are going to have, subdural hematoma or hemorrhage, right? In SH, they can write you, this is the worst headache of my life, worst headache. Blood will be in the sylvian fissure, worst headache of my life. Here, the shape will be crescent or half moon shape is going to be there, right? Here, worst headache of my life, and this is going to be blood will be present in the sylvian fissure, right? Okay, CSF is going to be, yes, this is going to be the, yeah. So we are going to take out the CSF, and this CSF we are going to study. The normal function of CSF is produced in choroid plexus, and it will be draining all the way through the cerebrum and spinal cord, right? It has got multiple things. It has got what? It has got glucose, it has got oxygen, it has got various metabolites, right? So we are going to look for all these things, right? Because we already know anytime you have bacterial infection, you will be having increase in the pus. Bacteria loves to eat glucose. Glucose is loved by the bacteria. Bacteria loves glucose, right? A virus does not want glucose. Simple understanding. Virus has got what? Bacteria has got problem with the food. Bacteria don't have food. Virus has got a problem. Virus don't have what? Reproductive things. Virus do not have things for the reproduction. That is why this virus is going to bind with other cell. That is why this virus is going to bind with the other cell. It will hijack the other cells for the reproduction purpose. Bacteria can reproduce, but bacteria have issue with the food, right? So this is the basic problem, right? So viral infections will not have issues with the glucose. So let's try to understand the what are the CSF picture you are going to get. Anytime you have bacterial infection, bacteria will eat up the glucose, right? So what will happen to the glucose? Glucose will be very low. This is the first thing you have to remember. The values they are giving right now in NEET PG examination, they are writing the values. So basic three values you have to remember. Normal glucose is going to be what? 50 to 80. If you have decreased in the glucose, this is going to be what? Bacterial infection. Second thing who is going to increase, this is going to be neutrophils or PMN cells. These are going to get increased. These are acute cells for the bacterial infection, right? So anytime you have bacterial meningitis in CSF that you are draining, right? L3, L4, 5, right? The CSF that you are draining, you will be finding what? You will be finding what? You will be finding very low sugar will be there. You will be finding WBCs are going to get increased. Pressure will also be high, and the proteins are going to be high, right? And the appearance is going to be what? Bacteria will make everything dirty, right? This is going to produce pus. So yellow turbid CSF, you can look at the CSF, you can identify. In viral infection, what is going to be there? In viral infection, you are going to have no issues with the glucose, right? So glucose is going to be what? Normal here. And lymphocytes are going to get increased. We know viral infection, lymphocytes will be increased, right? And pressure will be again high, right? Appearance is going to be clear. Remember, clear viscous, clear fluid is coming from anywhere. This is going to be generally viral. In tubercular meningitis, what can happen? This is going to produce a special appearance. This is known as what? Cobweb coagulum. This has been asked previously. Cobweb coagulum, right? Here, remember, it is a chronic process, so lymphocytes will increase, right? Glucose will be low since it is a bacteria. So this is what you need to remember. This is going to be the picture of what? Tubercular meningitis. So let's try to understand the basic causes of meningitis. If they ask you question, what is the most common cause of meningitis? They can write you the time period. Time period is important. If they ask you about a neonate, neonate is 0 to 28 days. First 7 days is going to be early neonate, 7 to 28 is late neonate, right? So this is going to be group B streptococci followed by E. coli. Group B streptococci is not so common in India, right? But it is the overall most important cause for neonatal meningitis, followed by E. coli, followed by Klebsiella, right? In elderly patient, in children patient, remember the story of Lisa auntie, right? This is going to be what? This is going to be listeria can be the cause. In children also the most important, one of the important causes is going to be what? Haemophilus influenza B. HIV positive patient with meningitis, you know the answer will be what? Cryptococcus. In adult patient, normal patient, the patient is coming with the symptoms of meningitis, I told you this is going to be what? Pneumococcus, also known as streptococcus pneumonia. It is the most common cause for meningitis also, it is the most common cause for pneumonia also, right? Anytime you have patient with the rash, this is your NEET PG last exam question, instead of rash they have written what? Patient is having petechial rashes. Always remember meningitis symptoms with bleeding, with rash, with petechias, always your answer is going to go in the favor of what? Meningococci beta, meningococci is the answer, right? And cobweb coagulum, if it is written, this is going to be simple, this is going to be tubercular meningitis. This is going to be tubercular meningitis, right? This is the viral causes of meningitis, bacterial causes of meningitis that we have discussed. No issues with this, right? So let's move forward about the pneumonia. What is the stem of the question? The stem: headache, fever, nuchal rigidity, Karnik Brudzinski positive, projectile vomiting. Look at the time period, you will get your answer. Look at the time period and look at the whether they have written gram positive, gram negative. You rule out, your answer will be there. They can also ask you from medicine this type of question. They can ask you, you have to remember these three values. You will be able to answer your question. Simple concept. Remember, neutrophils increase, bacterial infection, lymphocyte increase, viral infection. If lymphocytes are increased and cobweb coagulum is given and there is going to be low glucose, your answer will be tubercular meningitis. This is going to be simple understanding, right? Now let's talk about the pneumonia question. They can write you, a patient is coming to you with cough. What are the symptoms of pneumonia? Respiratory rate will be altered, patient will be having cough, patient can have headache, patient can have fever. This is going to be what? In the favor of what? In the favor of pneumonia. They cannot give you diagnosis. Sometimes they can give you pneumonia, sometimes they will just give you the symptoms. You have to make the diagnosis. Basic symptoms at least you have to remember. You see CSF, you think about what? Meningitis. You see cough in the patient, you think about what? Pneumonia, right? There are going to be two important types of pneumonia that you have to remember. One is going to be typical or lobar pneumonia, where you will be having involvement of any lobes of the body. In atypical pneumonia, this is also known as walking pneumonia. Walking means patient will be having what? Less symptoms and the disease will be more. So if you go for HRCT scan, you will find 60% of the lungs are damaged, right? This is known as walking pneumonia. The most common cause for walking pneumonia is going to be mycoplasma, or maybe due to COVID-19. During COVID-19, the same thing was happening. Patient was feeling fine and suddenly he will be having what? ARDS. What is ARDS? Acute respiratory distress syndrome. Acute means the time period is given, right? It is a short period respiratory distress. If the same RDS is happening in the baby, we call it what? Try to answer, right? Legionella, I told you, Legionella central AC, dirty water. This is also going to cause what? This is also going to cause what? Atypical pneumonia. In fact, the drug of choice for this two things is going to be what? What you were taking during COVID-19. In fact, it was a viral infection, but still you were taking what? Azithromycin. Azithromycin is a drug of choice for 4 conditions. This is going to be CLAP. C for chancroid, it is the drug of choice beta. L for Legionella. A for atypical pneumonia, and P for pertussis. This is also you can remember. So these are the four things where you are going to use azithromycin, not other things, right? Not common, normal, common cold. You are not going to take that is useless, right? So this is going to be what? Chancroid, Legionella, atypical pneumonia, and P for pertussis. Simple understanding, right? This is going to be what? Atypical pneumonia. Typical pneumonia will involve a single lobe. You will be having more symptoms since alveoli are going to get involved. More symptoms are going to be there, but the disease is going to be less. You go for scan, only 5% lungs are problematic. Here the most important clue that you have to look in the question, if consolidation is written, this is going to be what? In the favor of typical pneumonia. Most common cause is going to be pneumococcus. Pneumococcus is the most common cause for pneumonia. Also, this is the most common cause for meningitis also. Most common cause for meningitis, most common cause for pneumonia, answer will be what? Pneumococcus, right? Another example, they can ask you another thing, they can ask you, they can give you alcoholic patient. If they write you alcoholic patient, this is going to be what? Klebsiella, Klebsiella, right? Here you will be finding two other words. They can write you red currant jelly sputum, red currant jelly sputum. Tell me, where do you find red currant jelly stool? Jelly sputum is going to be here. And on x-ray you can find what? Bulging fissure sign, bulging fissure sign. This is going to go in the favor of what? Klebsiella, Klebsiella pneumonia, right? Atypical pneumonia can be due to mycoplasma. Just now we have seen mycoplasma. Chlamydia due to bird handlers. Legionella is a previous year exam question, and this virus is going to viral infections can be there. This is also going to cause what? Atypical pneumonia. If in the question they have written the word cystic fibrosis, always think about what? Pseudomonas. Always think about what? Pseudomonas. Shabash, very good, Vigneshwar and KBPSK, right? This is going to be what? Red currant jelly stool is going to be seen in the cases of intussusception. Yes, wonderful. Okay, HIV positive patient with the pneumonia, we have already seen this is going to be pneumocystis cerevisiae pneumonia with crescent ping pong ball appearance is going to be there. CD4 count will be less than 200, right? COPD patient will be having streptococcus pneumonia or Haemophilus influenza is the cause. Ventilator associated pneumonia, if they ask you, answer will be Pseudomonas. In world, you can also ask, they can ask you from the pediatric or word point of view, you can also answer Acinetobacter. These are the two options you have to remember. Nosocomial pneumonia, this is going to be what? Hospital acquired. This is going to be what? Staph aureus is going to be your answer, right? So these are the basic causes of pneumonia that you have to remember. Pneumonia symptoms you have to remember, and question is going to be like this only. They give you symptoms, they ask you, they give you the time period, they give you certain other symptoms. The patient is having cystic fibrosis, think about Pseudomonas. Patient is having COPD, think about Streptococcus pneumonia. HIV positive, this is going to be CD4 count 200, pneumocystis cerevisiae. Ventilator associated pneumonia, Pseudomonas, right? Nosocomial pneumonia, Staph aureus is the cause. Now on the basis of CD4 count, we are dividing this thing into multiple parts, right? What are the infections you can have on the basis of CD4 count? Remember one thing, we are going to start our patient treatment irrespective of the CD4 count if that is coming out to be positive for HIV, right? The most common opportunistic infection that you are going to have at a count of less than 500, this is going to be TB. TB is the most important common opportunistic infection in HIV positive patient. Apart from that, oral infection or fungal infection is going to be what? Oral candidiasis, you can appreciate very commonly, right? CD4 count is coming below 200, you think about what? Pneumocystis cerevisiae pneumonia or cryptosporidium. I told you this cryptosporidium is the most common cause of diarrhea in the HIV positive patient. Three things I told you today. First thing, most common cause of meningitis in HIV positive patient, that is going to be what? Cryptococcus. Most common cause for diarrhea in HIV positive patient, answer will be cryptosporidium. Most common cause of pneumonia is going to be pneumocystis cerevisiae pneumonia, CD4 count around 200. You can also have toxoplasma or histoplasma, right? This thing we will discuss further. If CD4 count is less than 50, you can have CMV, you can have MAC infections, and cryptococcus can also be there, which can lead to what? Meningitis in the same patient, right? So these are the important causes that you have to remember so that we can rule out on the basis of CD4 count, right? And we can treat our patient also very nicely. The next thing is about the dysentery. For dysentery, you have to remember these 5 causes. What are these 5 causes? This is going to be what? Campylobacter. Campylobacter jejuni, I told you this is going to cause what? Guillain-Barré syndrome associated with the GBS. This can lead to what? Dysentery. Apart from dysentery is what? Dysentery means blood with diarrhea, blood with stool. This is known as dysentery, right? Entamoeba histolytica. Histo means tissue, lytica means it is going to break the tissue. If it is going to break the tissue, what will happen? It will go to submucosa, it will break the tissue, you will have bleeding, and this bleeding will be coming out into the stool. This is known as what? Entamoeba histolytica, amoebic dysentery. It can even lead to liver abscess. Very, very important. 2 things are going to be there. One is liver abscess, another one is going to be hydatid. Both are different, but don't get confused. Hydatid is due to a cystode. That cystode is known as what? Echinococcus granulosus. Echinococcus granulosus, right? That is going to be the cystoda we are having, which is going to cause what? Hydatid of the liver, right? And liver abscess is due to what? Liver abscess is due to Entamoeba histolytica, right? This liver abscess will be having what? trophozoites you can find, and this trophozoites will be having erythrophagocytosis, you can see. All right, and the next thing is going to be EHEC. Remember, these are the strains of enterohemorrhagic E. coli, enteroinvasive E. coli. Both of them are going to be what? They are E. coli. They are E. coli. They can cause what? Diarrhea along with the blood. So that is known as what? That is known as what? Dysentery. So O157H7, same association will be there, and this is going to invade what? Enteroinvasive means it is going to invade the colonic mucosa, leading to what? Bleeding. Shigella will be causing one of the most important cause for dysentery, and this is going to have Shigella-like toxins, and this dysentery is known as bacillary dysentery, right? So 5 causes you have to remember: Campylobacter jejuni, right, Entamoeba histolytica, EHEC, EIEC, and Shigella. These are the 5 important causes you cannot forget, right? You can have watery diarrhea. You can appreciate with the Clostridium difficile. I told you this is difficult to culture, that is why it is known as difficile. It can cause what? Pseudomembranous colitis beta. Pseudomembranous colitis is the disease that we can appreciate. Next one is your Clostridium perfringens, can lead to what? Gas gangrene. This is Clostridium, it goes deeper infections are going to be there. You can use what? 100% hyperbaric oxygen, right? So it can get killed, right? ETEC, enterotoxigenic E. coli. T for T, this is going to be causing what? Traveler's diarrhea. Protozoa which are causing diarrhea is going to be the most common parasitic infection, is going to be what? Giardia. Then you can have Cryptosporidium parvum in HIV positive individuals. Vibrio cholera can lead to what? Rice watery stool, rice watery diarrhea. And adult patient you can have what? Norovirus. In children you can have what? Rotavirus. These are the viral infection which can lead to diarrhea in the normal individual, right? So this is going to be the story of diarrhea. Now about the endocarditis, what they are going to write you in the endocarditis question, they can ask you, they can give you big history. What is the history? There will be a patient with some kind of Jain lesions are going to be there, right? The patient can, you can also identify the Osler nodes. You can have road spots in the eyes, right? This thing can be there. Jain lesions, if they are going to combine it with the pathology or medicine, they can write you Osler nodes or road spots. And 2D echo, very important, like we have discussed. Anytime you say CSF in the question, you think about what? Meningitis. The same thing, anytime you say 2D echo, you think about what? Echocardiography. You think about what? You think about, they are thinking about what? Endocarditis. You have to think about endocarditis. What is endocarditis? Endocardium, you have to think about the heart valves, right? Anytime they are going to write in the question vegetations on valves, you think about what? Endocarditis. This is how you have to think here, right? So we can have native valve endocarditis, that means the person is having his own valve. This is going to have infective endocarditis. Most common infective endocarditis. This is acute and most common, normally seen with the IV drug abusers, and the causative agent is going to be what? Very important. Last exam question, last exam they have asked about this particular endocarditis. Answer will be Staph aureus, right? Instead of native valve, if they ask the same question, IV drug abuser, instead of native valve, if they write you prosthetic valve, that means person has got some surgery. Now the answer will be what? Pseudomonas. Now the answer will be what? Pseudomonas. This is for the native valve or prosthetic valve endocarditis, right? Another question they can ask you, prosthetic valve endocarditis, right? Prosthetic valve endocarditis, if it is early, this is going to be Staph epidermidis. Since it is present on the skin, it can enter early, right? If they are asking for the late, this is going to be Streptococcus viridans. And this viridans, you have to remember, late means more than 1 year, and generally this thing is associated with the dental problems, right? Post dental surgery, post RCT was the exam question. They have asked this question from here. Post RCT patient, RCT means root canal treatment, right? So post RCT patient is having what? Symptoms of vegetations on the valves, new onset regurgitation. You have to think in the terms of what? Shortness of breath. You have to think in the terms of endocarditis, right? So this is going to be a case of endocarditis, and the causative agent is going to be viridans. Now I told you they can write you the causative, they can write you big question, and in that big question they can write you the same thing. You have to remember overpass. They can write you the patient is diagnosed with endocarditis, and the patient is having what? Patient is having endocarditis which is resistant to what? Which is resistant to optochin, which is alpha hemolytic. They can write you alpha hemolytic bacteria. You have to think about what? 2 bacteria, viridans and pneumococcus. Then they can write you the bacteria is optochin resistant. Then your answer will be what? Your answer will be they are talking about the viridans, right? So this is what you need to remember. What is the criteria we are following here? The criteria is modified Duke's criteria. Where do you follow the modified Jones criteria, beta? Where do you follow modified Jones criteria? Right answer, right? Enterococcus, E for enterococcus in the elderly patient with some kind of genitourinary or GIT kind of procedure. This is the patient who is going to have due to endocarditis due to enterococcus, right? So if they ask you simple question, if they ask you native valve endocarditis, most common cause Staph aureus. IV drug abuser, native valve endocarditis, Staph aureus. Okay. Second thing, native valve endocarditis, prosthetic valve endocarditis, IV drug abuser, answer will be Pseudomonas. Prosthetic valve, IV drug abuser, answer will be Pseudomonas. Early onset, your answer will be what? Prosthetic valve. Early onset, answer will be epidermidis. Late onset, answer will be viridins. This is important stuff, very important. They have asked questions from here, right? Modified Duke's criteria we are going to follow here, right? Modified Jones criteria for the ARF, very good, right? So that is for the ARF, right? We can also have some gram-negative bacteria causing endocarditis. They are known as Hackett group of bacteria, right? Haemophilus, Aprophilus, Para-Aprophilus, we have seen Coxella, right? Coxella burnetii is also going to be there, which can cause what? Culture negative endocarditis. It is going to be what? Cardiobacterium, Eikenella and Kingella. These are the causative agent for Hackett group, right? This is also important. If this much you can remember, your endocarditis question will be solved, right? This is the important thing. Now some keywords and you have to answer me. Just try to participate. If a patient, they are going to give you some keywords in the question, they can write you what? A patient is coming to you with rice, watery stools and hypotension. You have to think in the terms of what is going to be your diagnosis. Try to answer as fast as possible. All right, rice watery stool with hypotension, right? Rice watery diarrhea is going to be due to, this is due to Vibrio cholera. Right? Unvaccinated child with bull neck, pseudomembrane on the tongue. This is going to be what? This is going to be what? Unvaccinated child with pseudomembrane on the tongue, and bull neck is also written. This is going to be, very good, this is going to be diphtheria. Diphtheria is bacteremia or a toxemia. Remember, it is a toxemia. The treatment will be anti-diphtheric serum. Do you think people will nowadays also coming with diphtheria? Yes, in our OPDs we are finding patients with diphtheria. Everything was same. We need to give prophylaxis to other people who are coming in surrounding also, right? This is going to be what? Diphtheria. ADS is the anti-diphtheric serum. The dose has been asked previously. That is going to be 80,000 to 1,20,000 is the dose, right? That is what we are going to give. Now patient is having vomiting after 1 to 6 hours, fried rice. Your answer will be what? Your answer will be 1 to 6 hours, fried rice, Chinese fried rice. This is going to be what? Bacillus cereus, beta, Bacillus cereus. Post antibiotic, if patient is having diarrhea with pseudomembrane in the colon, the answer will be what? These are the keywords you have to identify. If you identify these keywords, micro can give you 100% strike rate, but 100% strike rate will be there. Or we can do one thing, if you want, if you have time, you can join me on Telegram group, or maybe on a YouTube. It is going to be slow, little bit slow, so you can join me on my Telegram group, right? It is in the PDF, and I would be telling you, I would be putting these questions, these keywords, and you have to answer it, right? We can have this type of session for the microbiology just before the examination. Okay, so join me there. So post antibiotic diarrhea with pseudomembrane in the colon. Post antibiotic third generation cephalosporin patient is taking for some disease, and he is having what? Pseudomembranous colitis, right? What is going to be the causative agent? The causative agent is going to be what? Clostridium difficile, beta, right? Honey ingestion, patient is presented with the flaccid paralysis. Baby is going to be there, right? Baby is going to be there. You are giving honey to the baby, right? Earlier हम लोग क्या करते थे? बच्चे को शहद चटा दिया, थोड़ा सा शहद अगर बच्चे को दे दिया, what will happen in the baby? Baby can have flaccid paralysis. Flaccid paralysis can be there, right? And remember, flaccid paralysis will be a lower motor neuron type of lesion, right? Spastic is going to be upper motor neuron, right? So what is going to be your story here? This story will be honey ingestion. This is going to be Clostridium botulinum, beta. Clostridium botulinum is going to be there. Clostridium Yes, the link you can scan the PDF. This PDF in the beginning we have got the link for YouTube channel, Telegram, and Instagram. All of them are there, right? ICU patient, they are going to give you a patient is admitted in ICU for some cause. Maybe the patient was having shock. Now the patient is having what symptoms of pneumonia, respiratory rate is increased, cough is there, sputum is there. Remember, anytime bacterial infection, cough and sputum will be there. Viral infection, generally watery discharge will be there, right? And the treatment will be viral, 99% symptomatic treatment along with the water. For bacterial infection, you give antibiotic, that too very specific, right? So ICU patient means you understand ventilator associated pneumonia. You have to think in the terms of what? Pseudomonas, beta. Pseudomonas. If Acinetobacter is also there in the option, this is going to be the Acinetobacter is going to be the answer. If they write you any burn wound patient with bluish pigmentation, remember burn wound patients are dying because of the pseudomonas, right? And how you are going to do the dressing of this patient, very important. Burn wound patient, pseudomonas, the dressing is done with the help of what? Dressing is done with the help of silver sulfadiazine, right? Silver sulfide or silver sulfadiazine, this has been asked. Right? Fever with myalgia with conjunctival suffusion. Your last exam, NEET PG as well as FMG question, they have asked you, patient is having fever with myalgia with conjunctival suffusion. Most of the people marked it as dengue, right? Because fever is going to be there in the dengue, myalgia, muscle pain can be there in the dengue, right? But remember, this conjunctival suffusion is a very important thing that you will not find in the dengue. Now you have to answer what? This is going to be what? This is going to be leptospira, beta. This is going to be leptospira. Leptospira after rainy season, rat urine, rainy season, rice field or paddy fields. This is going to be what? This is going to be leptospira. Another farmer going to the forest, last exam question, another farmer going to the forest coming with a black color rash along with the fever and lymphadenopathy, they will write you a big question. The simple keywords you have to identify, farmer or another person is going to the forest, and this person is going to have what? Black color lesion, and this black color lesion is going to be known as scar, right? In the main classes we have discussed two important black color lesion. One is going to be here, right? And patient is having what? Fever, lymphadenopathy is going to be there. You have to think in the terms of what is going to be your diagnosis. This is going to be, remember the table we have seen, louse flea, tick tick, mite mite, louse flea, tick tick, mite mite, right? That was due to a mite. In the question they have also written it as a mite borne disease, and the name of the mite is going to be what? Aurantia sushugamushi. Very good. This is going to be Aurantia sushugamushi, and the disease is known as what? Scrub typhus. Disease is known as what? Scrub typhus. Remember this scrub typhus, your brucella, these things. Leptospira, the drug of choice is going to be what? Doxycycline. Leptospira, brucella, scrub typhus, right? And dengue also, the drug of choice, we are trying to give doxycycline just to rule out what? Just to rule out these infections, because they can cause what? Problems for long time. In fact, this brucella, if you are having brucella, you need to give treatment till like 6 weeks, the same drugs like doxycycline, right? Another question we are having, this is from the exam only, forest animal skin or rash is having, and that rash is also again black. Person is going into forest, he is doing what? Animal skin transporter. They are known as what? Hide porters. They are transporting the hides, right? Now it's very simple. Now what is going to be your answer? Hide porter disease. What is going to be the hide porter disease that we are having? Hide porters. This is going to be what? This is Bacillus anthracis. So remember, two black color lesion. Last exam also I told you, and this is what is important, right? This has been asked previously in the last exam. We are having Bacillus anthracis and scrub typhus will be having black color lesion, right? This black color lesion in Bacillus anthracis is known as what? Malignant pustule. This is known as malignant pustule. We can have three types of anthracis. We can have Hyde-Porter's disease, those people who are carrying the dead skin, dead animal skin, that is known as Hyde-Porter's disease. Second thing is pulmonary anthrax, those people who are sorting the wools, they can have inhalation of this anthracis, right? So this can lead to wool sorter's disease, and we are preventing it by doing the formication. What is formication? We are using pre-treating the wool with the formaldehyde. And third is going to be intestinal anthracis. Drug of choice is going to be Cipro or Doxy we can use. Okay, next question. This is also your exam question. Vesicles with giant cells. What are the vesicles you are going to find with the giant cells? Vesicles with the giant cells, and these cells are known as Zenk cells, and we can do Zenk smear. What is Zenk smear? Suppose any lesion is there, I am going to rupture the top of this lesion. I am going to take the sample from the base, I am going to put it on the slide, I am going to put some stain, and I am going to see it inside the microscope. This is known as Zenk smear formation. This is a normal bedside test we are performing in our like dermatology people. Any patient coming with some kind of vesicle, we rupture it, we see it inside microscope. This is known as Zenk cell, right? Vesicles, anytime you see vesicles with Zenk cells, remember this is going to be a case of herpes. Herpes means what? Herpes means grouped vesicle, beta. Herpes means grouped vesicle. So this grouped vesicles are going to be there. In the exam, they have given you the option HSV1, HSV2 or HHV3. All these three, you will be finding what? You will be finding Zenk cells are going to be there. Anytime you see vesicles, you think about what? Vesicles means what? Clear fluid filled lesion less than 1 centimeter. Clear fluid means viral infection. So this is going to be herpes. Always remember, you see vesicle, you think about herpes, right? HIV positive patient with neck stiffness and bird seed agar. HIV positive patient with neck stiffness and bird seed agar. This is going to be your answer, is going to be what? Multiple ring-shaped trophozoid. Try to answer this one. Multiple ring-shaped trophozoids with HRP2 antigen positivity. HRP2 antigen positivity. What you are thinking? HRP2 antigen positivity. This is going to be what? Plasmodium. Plasmodium is the causative agent, and the answer will be Plasmodium falciparum. Right? Nighttime perianal pruritus. Nighttime perianal pruritus, around the anal. This is your exam question, perianal pruritus. What is going to be your answer? The egg will be looking like D. Egg will be looking like D. So this bird seed agar neck stiffness is suggestive of what, beta? Neck stiffness. Just try to read these keywords. Neck stiffness matlab kya hoga? Neck stiffness matlab patient will be having what? Nuchal rigidity. Nuchal rigidity is seen in meningitis. What is the most common cause for meningitis? HIV positive patient. Now try to answer. HIV positive patient, most common cause of meningitis. This is going to be what? HIV positive patient, cryptococcal meningitis. And for cryptococcal meningitis, you can do what? You can do bird seed agar. For CSF sample of cryptococcal meningitis, you can use what? You can remember this cryptococcal CSF sample, you are going to use what? India ink or nigrosin stain. For tissue sample, you are going to use what? Mu-C carmine stain. For fluorescent microscopy, you are going to use what? Fungus. It is a fungus, so calcoflower white you can use. Calcoflower white. This is how we can make the diagnosis of cryptococcal meningitis. Very good, beta. Right? Next thing is your perianal pruritus. Before D, D-shape egg. Remember D-shape egg. Before D, there will be E. So remember E for E, Enterobius vermicularis. This is going to be what? Enterobius vermicularis. Shabash, vermicularis. Right? And lastly, history of pork. History of pork intake. If someone is eating pork and the patient starts to have what? Atypical seizure. Remember, seizure will always have what? A cause. Epilepsy will not have any cause. What is epilepsy and seizure? Seizure will always have a cause, like febrile seizure. Because of fever, the patient is having seizure. This is known as what? Febrile seizure. Here what is happening? Atypical seizure. So why seizures are happening in the patient? Something is touching what? Brain parenchyma. Who is going to touch the brain parenchyma here? NCC, neurocystic sarcosis, beta. Neurocystic sarcosis. Neurocystic sarcosis is the disease we are having. And what is happening? This particular thing is happening due to tinea Solium, tinea solium is going to be the causative agent which is associated with the pork, right? So this is going to be the tinea solium. If you remember these type of keywords they are giving in the examination, you would be able to solve the question, right? So we are done with the most of the microbiology, like bacteriology questions which they have been asking, right? Are you able to understand? Good. Getting the confidence. All right, so now we will discuss about some fungus beta. Now we will discuss about some fungus. Very good. So what are the fungus we are going to have, right? Yes, we will also do one session just before the examination where I would be putting the keywords on the Telegram channel. In the night time we will have around 8 or 9, whatever time you are sleeping. I will also make you understand how to go for the examination. This is also important, right? So I will put it over there. Okay. The next thing we are having is pityriasis versicolor. Pityriasis का मतलब क्या होता है? What is the meaning of pityriasis? Pityriasis means scaling, beta, scaling. Versicolor means different color. So different colors are going to be what? Hypo and hyper pigmented scaling is going to be there. Hypo and hyper pigmented scaling is also going to be there. This is going to be what? Pityriasis. Can you appreciate? Hypo and hyper pigmented color is going to be there, right? Another thing that you have to remember, this is going to be the causative agent. They have asked the question, patient is having what? Pityriasis versicolor, right? What is going to be the causative agent? Remember in the option they have written what? Malassezia. So Malassezia can be of two types. Malassezia globosa can be there and furfur can also be there. That is what you have to remember. So what you are going to have? Hypo and hyper pigmented patches. Pigmented patches can be there. Macules can be there. What is a macule? Macule is a flat discoloration, flat lesion which is going to be less than 1 centimeter is known as what? Macule. This is known as macule. So you can have what? Flat discoloration with what kind of scaling will be there here, beta? This is going to have fine scaling. Fine scaling also known as what? This is also known as brainy scales. Pityriasis का मतलब ही क्या होता है? Scaling, right? So you can have fine scaling, brainy scaling, rice powder like scaling, right? These things are written. You have to think in the terms of pityriasis versicolor. One more entity is also going to be there. That is a papillosquamous disorder. That is known as pityriasis rosea. Both are different. Pityriasis rosea matlab R for R, you have to remember that is going to be red color lesion on the trunk only, and that is going to have the first patch is known as what? Mother patch. Contrast करना important है. That is known as mother patch or herald patch. Herald patch. Mother patch or herald patch, और उसके चारों तरफ here you will be having growth in a pattern. That pattern is known as what? Christmas tree pattern. Christmas tree pattern. Right? And वहाँ पर कौन सी scaling होगी? There you will be finding with what kind of scaling? There you will be finding collarate of scale. Collarate of scales will be there. Cigarette paper like scales will be there. Cigarette paper like scale. Or what sign will be there? That is known as hanging curtain sign will be there. Hanging curtain sign will be there. This is going to be the thing we are going to have in the pityriasis rosea. Now compare it with the pityriasis versicolor. Versicolor will be having hypo and hyperpigmented lesion on the back, right, on the trunk. Fine scaling will be there commonly on the upper trunk, neck, around the shoulder. This is going to be often asymptomatic. It is a fungal infection, mildly itchy fungal infection will be there. Pathogenesis क्या होगा? This is going to produce what? Azelaic acid. Remember this azelaic acid is a whitening agent. ये जो azelaic acid होता है, this is the whitening agent we are having. This is going to make you white, right? The color of this white color or hypopigmentation is due to what? The answer will be due to azelaic acid. Azelaic acid, right? It is something which you will find in the whitening, skin whitening creams also. Right? How you are going to make the diagnosis? You are going to take the scraping from this lesion. You are going to take the scraping from this lesion. You are going to put it under KOH mount. Sir, why to put under KOH mount? To remove the keratins, right? So this is going to be keratolytic, and under KOH mount you are going to get this appearance. This is your favorite examiner question. This appearance is known as spaghetti and meatball appearance, beta. Spaghetti and meatball appearance. This appearance is known as spaghetti and meatball appearance. also known as banana and grapes. Banana and grapes appearance. So this is the appearance you will be finding in the pityriasis versicolor. Versicolor, you will be having spaghetti and meatball appearance or banana or grapes appearance. When you are going to put the same thing, KOH mount बनाने के बाद में we can put the same thing under SDA, seborrheic agar. This is your exam question, last exam question. They have given you a case of कैंडिडा का केस दिया था लास्ट एग्जाम में, एंड दे आर गोइंग टू आस्क यू व्हाट इज द अगार वी आर गोइंग टू यूज. सो लेट मी टेल यू वेरी सिंपली, ऑल द फंगस यू कैन यूज व्हाट seborrheic dextrose agar, that is known as seborrheic dextrose agar. The answer will be seborrheic dextrose agar. Like we are growing what, like we are growing all the bacteria under culture media. So the same way you can grow the fungus under seborrheic dextrose agar. And under this seborrheic dextrose agar, you can appreciate when you are going to add on what, olive oil, you are going to find what, this appearance. Isn't it looking like a fried egg appearance? So this is your fried egg appearance under seborrheic dextrose agar. And this fried egg, I told you 2 places also. Now you can recall again, oligodendroglioma and mycoplasma will also have what, fried egg colonies. This is going to be what, simple understanding. Fried egg, 3 things should be in your mind. One is going to be pityriasis versicolor, second one is going to be oligodendroglioma, third one is going to be mycoplasma. Treatment you can apply, generally it is asymptomatic, it is a fungal infection, no need for treatment. But if you are having itching, mildly itching is going to be there, you can use what, azoles. And remember, all these azoles are going to be what, static-or-cidal drugs. These are going to be your static drugs, very very important. Okay, so this is going to be the azoles that you can use, right? Here it is going to be pityriasis rosea, which is going to be again a papilloscomus disorder. You understand this, right? Now this is going to be superficial fungal infection. Now we will discuss about the subcutaneous fungal infection, which are going to be what, MRCS group of infections. MRCS, what is MRCS? M for mycetoma. First one in front of you is going to be what, mycetoma. This is your mycetoma. We can have actinomycetoma, we can have eumycetoma. Actino is going to be what, actino is going to be what, bacterial, and eumycetoma is going to be what, after E there will be F, so this is going to be fungal. Okay, so fungal mycetoma can have what, black color discharge also there from the granules. You can have black color lesions coming out. This is known as black color sulfur granules can be there. This is going to be what, eumycetoma. Whereas if you can have this white color or yellow color granules, this is going to be what, actinomycetoma. For the treatment you can use the antibiotics, and the regimen that we are using is known as what, Welsh regimen. Welsh regimen, where you will be using cotrimoxazole, which is a combination of trimethoprim plus sulfamethoxazole, right, along with the amikacin. That is what is going to be what, that is going to be what, actinomycetoma. In eumycetoma you will be using what, antifungals, antifungal. And if antifungals are not effective, you can go for what, amputation. That is a basic thing you have to remember. All the fungal infections are going to be what, generally painless. If they are painless, they are not going to cause any pain. The patient will come later, and if they will come later, you will be having more infection. Whereas in the bacterial infection, they are having what, pus production, and if pus is going to be there, this is going to be a fast entity. The patient will be coming faster, and if the patient will be coming faster, he will be treated faster, right? That is what is going to be the thing you have to remember about the mycetoma. Okay, second one is going to be this particular one. Can you identify these bodies are known as what? Very important, these are known as chromoblastomycosis. Chromo means colorful, blastomycosis, it is a fungal infection. So this is going to be what, chromoblastomycosis. This is a verrucous lesion. We are going to have verrucous dementitious fungus. It is due to thorn pick. The bodies are known as what, copper penny bodies, medlar body. Name them, speak along with me. Medlar bodies, sclerotic body, also known as muruliform bodies, right? For treatment you can give what, itraconazole. This is a dementitious fungus due to Cladophyllofora, right? Phylophora, Cladophyllofora, these are going to be the causative agent. The next one we are having is rhinosporidiosis. This is going to be due to Rhinosporidium seabury, right? And the treatment is going to be what, dapsone. You can give dapsone, or you can do a surgery. That surgery is known as what, functional endoscopic sinus surgery. You can also have rhinoscleroma. Beta, what is rhinoscleroma? Rhinoscleroma. What is rhinoscleroma? And what is going to be rhinophyma? Let's club all them together. What is rhinoscleroma? What is rhinophyma? Rhinosporidium is due to Rhinosporidium seabury, right? It is a fungal one, right? This is going to be due to this particular person will be having mulberry like mass coming from the nose. You can give dapsone. If not, you can do what? Surgery, and this surgery will be functional endoscopic sinus surgery. What you will be finding if you do the histopathological examination, what things you will be finding here? Try to answer. Rhinophyma is going to be what? Potato nose. Potato nose, right? Here you will be having hypertrophy of what? Hypertrophy of which glands? Hypertrophy of sebaceous gland. Hypertrophy of sebaceous gland is known as what? Rhinophyma. Phyma is going to be potato nose. But what the scleroma? Rhino means nose, beta. Rhinoria, rhinoplasty. Rhino means nose. Phyma is going to be what? Potato like tumor. And scleroma means hardening. So remember, hard nose or woody nose. Remember the same thing. Woody nose or hard nose is going to be what? Rhinoscleroma. This is going to cause what? Scleroma means woody nose. Very good. This is going to be woody nose, right? And here on examination you will be finding what? Microbiology cells. Very important question. And which bodies? Russell bodies. Microbiology cells and Russell bodies. If you do histopathological examination, here you will be finding what? Endospores with spirules. Spirules with endospores. This is going to be the structure you will be finding here, right? So answer will be here rhinosporidiosis, rhinoscleroma, rhinophyma. These things should be clear, right? Where you are going to do one more disease is there. Do not confuse. This is known as atrophic rhinitis. Here you will be doing what operation? This operation is known as modified young operation. So modified young operation is something you are going to do in atrophic rhinitis. Merciful anosmia, there will be roomy nose, right? That is going to be atrophic rhinitis is going to be there. And that is due to which organism? Klebsiella ogyna. And this is due to Klebsiella rhinoscleromatis. Klebsiella rhinoscleromatis. Rhinoscleromatis. These are Klebsiella. And one Klebsiella is going to cause what? That is your first thing, pneumonia. That is what we have seen. Klebsiella pneumonia, red currant jelly sputum with bulging fissure sign. Right? Yes. Swimming history will be there, and this thing will enter into nose. Everything will enter into nose, then it will goes to eye, right? How they will go to eye? With the help of this layer. This medial side is going to be what? Lamina papyracea, thinner layer. Now it can enter into brain through your cribriform plate. This thing can enter into your brain. And the same thing will happen in during the COVID-19 also. The mucormycosis that we have heard, right? Mucormycosis will enter through your nose, it will goes to your eyes, and it will go to your brain. That is why it is also known as rhinocerebral mycosis. Okay. So these are your subcutaneous fungus. Next one is going to be what? Dimorphic fungus, beta. Very important one question. At least you can anticipate from this slide, right? So dimorphic fungus are the fungus which can live in two phases, right? It can be mold, it can be yeast also, right? So this is going to be dimorphic. The first one is going to be what? Histoplasma. Remember histoplasma, you can remember this is also known as Ohio disease, right? This is also known as Darling disease. This is also known as Caves disease. Okay, you can remember high disease, Darling. Let's go to cave like that. Okay, and in the cave you will be finding what? You will be finding the droppings of the bats, right? And when you inhale those droppings, what can happen? You can have what? TB like symptoms. You can have pancytopenia. This thing will enter into your lungs, and these are your macrophages, and inside macrophages you will be finding what? Yeast, right? So intracellular yeast is a finding you will be finding inside the macrophage. Inside the macrophage you are going to find what? Yeast cell. This is a very specific finding you will be finding with the histoplasmosis. And remember, I told you HIV positive patient can have this thing very commonly. What is the kind of budding you will be having? Narrow based budding is going to be there, and this is your exam question. Tuberculate macroconidias are going to be there. This is going to have macroconidias like this. This is known as what? Tuberculate macroconidias are going to be there. Very important thing. right? This has been asked previously in the last NEET PG examination. Tuberculate microconidia, HIV positive patient with TB like symptoms, right? What are the symptoms of TB? Night chills are going to be there, patient will be having fever in the night time, weight loss is going to be there, cough more than 15 days, right? These are going to be the basic symptoms you have to remember. So this is going to be what? Histoplasmosis, narrow based budding. This is also has been asked. Ohio was given in the question. You have to just remember, if you can mark out Ohio, you can also mark out this is going to be what? This is going to be histoplasmosis. Okay, next one is going to be S. What is the mnemonic we have learned? That is going to be HSBC P square, right? HSBC P square. Second one is going to be S for sporotrichosis. Remember, here the yeast cell is going to be there surrounded by a pink eosinophilic material, right? Eosinophilic material means pink color material is going to be there, and the yeast cell is going to be there. This complete entity is known as which body? This is known as asteroid body. And this asteroid body is going to be there, and some phenomena is going to be there. That phenomena is going to be what? Splendor-Hoffley phenomena. Remember, this is also narrow based budding, right? This is sporotrichosis, also known as Rose Gardner's disease, Valentine disease, right? This is going to be sporotrichosis. What question they can ask you from blastomycosis is going to be the shape, right? Here you will be having a broad based budding, very very important. This broad based budding, everywhere you are finding what? Narrow based budding. Here you will be having a broad based budding is going to be there. And isn't it looking like a B? Can I make a B out of it? Yes, it is. 8 is looking like a B. Can I make a 8 out of it? Yes, I can make a 8 out of it. All these things you have to remember. So figure of 8 appearance is going to be there. Blastomycosis is going to be there. It is going to have a broad based budding. This is known as North American Gilchrist or Chicago disease. Very very important, right? Next thing is going to be HSBC for coccidiomycosis. This is known as desert rheumatism. It has got association with the soil beta, soil. Desert rheumatism, rheumatic like symptoms are going to be there, and this thing is associated with the soil, right? This is going to be known as what? Coccidiomycosis, right? Paracoccidio, you have to remember, for para this is going to be known as South American disease, and in South America you will find like that Mickey Mouse is living there, right? So Mickey Mouse appearance is going to be there, mariner wheel appearance is going to be there, pilot wheel appearance is going to be there. This is how you will reach to the South America. So this is going to be what? South American disease, pilot wheel appearance, Mickey Mouse appearance, and mariner wheel appearance. Lastly, we have got penicillinosis, HSBC P square. This penicillinosis is also known as what? Telleromycosis, right? Here you will be having brush border conidial appearance. Remember, anytime you see something blue in this particular thing, this is known as lactophenol cotton blue stain. Stain means color. This is just a color to see the fungus, right? So here you can find this brush border like appearance will be there. So this is looking like a broomstick, or this is looking like a brush, right? So this is looking like a brush, and here you can get the brick red pigment, right? So what kind of question they can ask you? They can ask you simple questions from here. Mickey Mouse appearance is seen in. Answer will be, let me ask you some questions. Mickey Mouse appearance is seen in. Mickey Mouse appearance is seen in. The answer will be paracoccidiomycosis. Okay, Ohio disease. The answer will be histoplasmosis. They will ask you North American or Gilchrist disease. The answer will be blastomycosis. This is your previous to previous year exam question. Last to last NEET PG they have asked. Broad based budding is seen with. 4 options were there. One is from here like histoplasmosis, sporotrichosis, and the right option is going to be what? Blastomycosis. So you can simply remember, broad based budding is a feature of what? Blastomycosis. Earlier they are asking questions from here. They are asking chromoblast or this sporotrichosis. Now they are asking question from here. This is a slide you have to be thorough with, right? So this is a basic thing you have to remember. Okay. Now some question they have asked from this particular part last time, right? So in the last FMG examination they have asked from here. So let's try to understand this particular thing, right? So we have got candida in the first go. We have got the candida. These are the opportunistic infection. We already know, if the CD4 count is around 500, this candida, oral candidiasis, at least that it can come, and that is what is known as what? Oral thrush, right? So let's try to understand what is this oral thrush we are having. This is a fungal infection we are having. What are the 2 phenomena you will be finding in the question? One is going to be, there will be written germ tube test in the question. If it is written germ tube test, you have to think about candida. This is known as germ tube formation, right? So this is going to be candida. And second is going to be Raynaud broad phenomena on corn meal agar, right? Corn meal agar, on corn meal agar. right? This is going to be what? Candida. This is going to be what? Candida. Here you will be having oral thrush will be there, and this is the chrome agar. Chrome agar can differentiate between multiple species of Candida. Previous year question, right? Why do we use chrome agar? To differentiate between the multiple species of Candida. Candida can happen in any neutropenic patient, right? This is going to have decrease in the immunity. The drug of choice for Candida is going to be what? Fluconazole. The drug of choice for Candida is going to be what? Fluconazole. The second infection is going to be what? This particular one. Can you appreciate the capsule? Negative stain. CSF sample is given. What is going to be your answer? Tissue biopsy. You will be finding these capsules in this tissue biopsy. These are the capsules. This is going to be the mucicarmine stain, right? The same for the same fungus, right? And this is your fluorescent microscopy for the same fungus. This fungus is a capsulated fungus. Remember the mnemonic for capsulated fungus? The one is going to be the, all of them are going to be bacteria. The one I've taught you is going to be what? Fungus, right? This is going to be what? Cryptococcus neoformis. Cryptococcus neoformis, which is in fact the most important cause of meningitis. Cryptococcus neoformis, which is the most important cause for meningitis in HIV positive patient. HIV positive patient with meningitis, your answer will be Cryptococcus neoformis. Okay, and the treatment will be liposomal amphotericin B along with the flucytosine. Previous year question which has been asked previously, they have given you 4 options. One, it is written liposomal amphotericin B. Another option, LAMP plus flucytosine. Another option was amphotericin B plus flucytosine. So right answer, remember, liposomal amphotericin B plus flucytosine. In fact, this liposomal amphotericin B is the drug of choice for Kala-Azar also, right? This is the same thing we are using in the Kala-Azar. What happens in mucormycosis? Mucormycosis is going to be, remember, it is going to enter through your nose, it will come through your eyes, and it will go to your brain like that, right? This is going to be the mucormycosis we can have. You can take the diagnosis with the help of nasal tissue biopsy. Diabetes mellitus patient is going to be there, right? This has been asked previously, right? So this is what you are going to take, and you are going to do before treatment. You have to do what? This is also your question. Surgical debridement is important. Surgical debridement is important before giving the treatment, and now you can do what? You can surgically debride the area and then you can give the drugs, right? This is what is going to be the mucormycosis. Remember, in mucormycosis the angle will be what? Angle will be either 90 degree or aseptate angle is going to be there, right? Aseptate is going to be there. Angle will be either 90 degree or maybe more than 90 degrees. So obtuse angle is going to be there, and you can have what? Aseptate hyphae are going to be there. This is how you can identify the mucor. Whereas in the cases of aspergillus, you can remember the acute angle will be there, and hyphae are going to be what? Septate. Hyphae are going to be septate. You can appreciate this is your aspergillus. Here you will be having what kind of branching also? This branching is known as, this branching pattern is known as what? Dichotomous branching pattern, right? One is coming out of two like that. This type of pattern is known as what? Dichotomous branching pattern. So this is going to be what? Aspergillus. This is going to be aspergillus, and the drug of choice for aspergillus is going to be what? Voriconazole. Whereas drug of choice for mucormycosis is liposomal. What other drugs? Oral drugs. Can you answer me? Oral drugs. Liposomal amphotericin B. Oral drugs. These are your posaconazole. We can also use isavuconazole. Posaconazole or isavuconazole is something we can also use for this mucormycosis. Lastly, we have got the fungal, or this is going to be having trophozoite and cystic trophozoite state also. This is going to be what? Pneumocystis cerevisiae pneumonia. CD4 count will be 200. This is the image they have asked in the examination. This is going to be on the gomori methionine silver stain. When you are going to put the silver, this is going to give you black color. So this is going to be the black color. Can you appreciate? It is looking like a half moon. This is a crescent shape, and these balls are looking like a ping pong ball, and this sample is going to be what? Bronchoalveolar lavage, right? We are entering into the bronchus, we are taking out it from the bronchus. This is your gomori methionine silver stain, right? Crescent shape, ping pong ball appearance. On X-ray you are going to find what? On X-ray you are going to find what? This is going to be perihilar lymphadenopathy will be there, with miliary mottling will be there. This is going to be the thing you are going to have, right? So this is going to be the thing you have to remember, and the drug of choice for this particular one is going to be what? Here the drug of choice for this one is going to be what? Cotrimoxazole. Cotrimoxazole, right? So this is about the fungus. This is about the fungus. Now we will discuss about the another thing. Now just try to solve the questions along with me. We have got limited time today, right? So now just try to solve some questions along with me. We will do in a format of test and discussion, right? An HIV positive patient is coming to the clinic. The same story with the history of diarrhea. Stool microscopy is showing the oocyst. The oocyst and the shape or size of oocyst is going to be what? 4 to 8 mm. The image is shown below. Identify the organism. Exam question. Try to answer now. Very good, Kavita. This is going to be what? Cryptosporidium. This is going to be what? Cryptosporidium. Shabash, Hazy, Shurbi, Cyclo, Hamad, everyone is in like fire, right? Great. Okay, so we are going to have what? We are going to have a size is given, that is going to be 4 to 8 micron. You have to remember in crypto these three things are known as what? These three are known as what? These are together known as coccidian parasites, beta. Coccidian parasites. And these coccidian parasites, you have to remember the shape. You have to remember the shape. All of them are going to be what? All of them are stained, right? All of them are going to be stained. All of them are stained. They are what? They are acid fast. They are all acid fast organisms, right? They are all acid fast organisms. Sir, how to differentiate? Remember, cryptosporidium and cyclospora are going to be what? They are looking like round. Cryptosporidium and cyclospora are going to be round. You can make a round out of it. So cryptosporidium and cyclospora are going to be round, whereas isospora is going to be what? Isospora is going to be what? Elongated, right? So these two are going to be round, whereas you have to remember crypto and cyclo. You have to remember this cyclo is going to show you cyclical change. Cyclical change means it's not necessary that all of them are going to get stained, right? Some of them are not going to get stained. So sometimes you will also get a picture where you will be having one or two and they are not stained, not at all stained, right? So this is going to be what? Cyclospora. If all of them are stained, you have to think about cryptosporidium. The drug of choice for cryptosporidium is going to be what? Nitazoxanide, Nitambani, nitazoxanide. And for these two, this is going to be what? For these two, you are going to use what? Yes, one more thing you have to remember. Look here. One more thing you have to remember, for this cryptosporidium parvum, the size of this particular one is going to be what? Size cryptosporidium, the name is small. Cryptosporidium, the name is bigger. The size will be small. For cyclospora, you can count cyclospora. This is going to be what? 1 2 3 4 5 6 7 8 9 10. So this is going to be 8 to 10 micron. This is going to be what? 8 to 10 micron. This is going to be 8 to 10 micron, right? And for isospora, this is going to be what? 23 to 36 micron. This is going to be 23 to 36 micron, right? For cyclospora, we are going to use nitazoxanide. For cryptosporidium, we are going to use what? Nitazoxanide. For cyclospora and isospora, we can use what? Again, combination of trimoxazole. Cotrimoxazole is the drug of choice. So answer in this case is going to be what? Cryptosporidium parvum. Yes, cryptosporidium, right? Next question. A male patient exhibit symptoms of fever with chills. The patient is having fever with chills. You have to think about what? Fever, chills and HRP2 positivity. These three things I was talking about. The rapid test indicated a positive result for specific antigen. What is the antigen? That is going to be HRP2. Based on the information, which species of Plasmodium is most likely to be responsible for this infection. So how many species of Plasmodium you have to remember? 5 species. Falciparum, Maleri, Vivax, Oval and Knowlesi. The 5th species is going to be what? Knowlesi. Anytime patient will be having symptoms of fever with chills, with one more sign you are going to find. What is the sign? This is going to be splenomegaly, beta. Why splenomegaly? Because the spleen is the graveyard of RBC. Anytime you have destruction, hemolysis in the body, there are going to be hemozoins coming out. Because of hemolysis, hemozoin are going to come out and they are going to produce what? Chills in the patient. Second thing, if RBCs are broken down, they will go to the spleen, they will get stored in the spleen, and what will happen? The size of the spleen will get bigger. So this is going to lead to two important things: fever with chills along with the splenomegaly. You have to think in the terms of what? Malaria can be there, right? So to rule out malaria, first thing you can do this particular card test. It is very simple and easy, right? How you can appreciate this card test? First question they have asked you, these card tests are based on what principle? So what is the principle they are working on? They are working on the principle of immunochromatography beta. Immuno means immune reaction is going to be there. Chromato means some color will be, changes will be there. So basically we are putting what? Suppose we have got antigen outside, so what we are going to put? Already antibody inside. As soon as you will put antigen here, what will happen? Antigen antibody reaction will be there and you will be having appearance of a line. So this principle is known as immunochromatography. But before using that, you have to understand how to read this particular thing. Always remember, if you do not have a control line, this test is going to be invalid, right? So whenever you buy something like that, you have to see control line is there. So this is going to be telling us about the whether this test is going to be valid or not. So first thing you have to check is the control line, right? Now this is a test for plasmodium. So we have got two lines here. What are those two lines are going to be there, right? So remember, we have got two antigen. One antigen is going to be what? Aldolase and LDH. These are going to be the things which are going to be present in all kind of malaria. These are the antigen which are going to be present in fact all kind of malaria is going to be there. These antigens are going to be present in all kind of malaria. Whereas another specific antigen, that is going to be HRP2, which is going to be present in Plasmodium falciparum only. This HRP2 is going to be present in Plasmodium falciparum only. So how we are going to assess? If you are going to have LDH or aldolase, what will happen? It will show a line, right? This is how we are going to read this particular thing, right? Look here, it is control line is positive. That means control is there. We are putting our sample and nothing is coming, no line is coming. That means our sample do not have what? Antigen. Our sample do not have LDH. Our sample do not have aldolase. Our sample do not have HRP. This is how we are going to understand, and that is why this test is coming out to be negative. Another patient, we are putting the same thing, and now what is happening? This patient is having LDH and aldolase positivity. So what will happen? First thing you will have to check whether test is valid. You will look at the control line, and now PAN means what? Now it is coming positive for what? LDH and aldolase. So that means this patient is having malaria. But is it malaria falciparum? No, it is not falciparum, because this PF antigen is for the HRP2. So this is not coming positive. That means this patient is having malaria, but it is not falciparum. Another case you are going to have, this patient is having what? Three lines coming. Control is normal. Second, PAN, that means malaria is going to be there, and PF means what? Which antigen? PF is telling this is going to be HRP2 antigen, your exam question. So if you get three lines, that means what? LDH is positive, aldolase is positive, and HRP2 is also positive. So what kind of malaria is this? This is malaria falciparum. Normal local people, what they understand, if you get two lines, it is going to be easy. If you get three lines, this is going to be severe. Why severe? Falciparum can enter into your brain. It can cause cerebral malaria, and if you have cerebral malaria, it can cause what problems, right? So that is what is, it can lead to death of the patient also. So this is what you need to remember. So if these things are positive, these are positive, that means malaria is positive, but it can be Vivex, it can be other malaria. But if HRP2 is coming positive, this is a serious problem, right? So what you need to remember here, the patient is having symptoms along with HRP2 positivity. Your answer will be what, beta? Your answer will be falciparum. Next question. What could be the likely diagnosis, likely cause of the patient's seizures given in the provided image of the brain? So what is going to be the positive probable cause here? You guys are not even reading the questions, marking direct answers. So patient is having what? Patient is having seizures, and these seizures are going to be what we have seen. Atypical seizures are going to be there. right? And this is due to what? Tinea solium. Tinea solium is associated with the pig's bitter. This Tinea solium is associated with the pigs, and the larva is going to be what? Cysticercus. When this cysticercus will enter into brain, this is known as neurocysticercosis. Saginata will be associated with the cattles. It is associated with the cattles. It can cause what? Intestinal teniasis. Whereas this Echinococcus granulosus, it is also going to be a cystode, and this Echinococcus has got what? It is also known as what? Dog tapeworm. And it can cause what? Hydatid cyst, which can cause liver abscess. Try to answer who can cause liver abscess. Cattles will be having T. Here Saginata will also have T. Okay, cow mata, nata, whatever you can remember, right? Hydatid cyst, right? And this hydatid cyst is going to be there in the liver. It can be present in the lungs also. It can be present in the brain also. What is the treatment we are going to do for hydatid? This is going to be what? Peer surgery, right? And what is the classification we are following? That is going to be what? Kirby classification has been asked, but what classification we are following is your WHO classification. And last to last exam they have asked about Kirby also, right? Lastly, cystostoma hematobium, which is going to be a trematode, right? This hematobium has got what? This is going to have what? Terminal spine beta. Terminal spine. This is going to be a trematode, and this is going to have terminal spine, which can cause what? Terminal hematuria. And this can cause cancer. What kind of cancer will be there? This cancer is known as what? This type of cancer is known as bladder carcinoma. It can cause what? Bladder carcinoma, right? So answer in this case is going to be what? A. The next question we are having is, which infection is characterized by the presence of bloody diarrhea? Bloody diarrhea. Bloody diarrhea means patient is having what? Dysentery. Bloody diarrhea means dysentery. Liver abscess, I have asked the same question. Liver abscess, right upper quadrant pain, and histology of the colon biopsy shows what? Flask shape ulcer. Very important, flask shape ulcer. So where do you find this flask shape ulcer? That is going to be seen in the cases of entamoeba. Giardia, what kind of motility we have seen? That is going to be falling leaf like motility, right? And this giardia can lead to what? Malabsorption. Monkey shape trophozoite will be there. Monkey shaped trophozoite will be there. And how many flagellas? 4 pairs of flagellas. And the drug of choice will be metronidazole, right? Here you will be having symptoms like patient will be having what are the symptoms? Flatulence can be there, right? Statoria can be there. These are the symptoms of this giardia, most common parasitic infection, right? Entamoeba, we have seen entamoeba histolytica, and this histo means tissue, lytica means it's going to break the tissue. It can lead to what? It can lead to liver abscess. It can lead to liver abscess, right? And when you see inside, you will be finding what? Trophozoites, right? And that trophozoite is going to be known as what? Erythrophagocytic trophozoite, because you will find what? RBCs inside them. Typhoid will be having what kind of ulcer? You will be having typhoid will be having longitudinal ulcer. Tie is going to be long, so you can remember longitudinal ulcer is going to be there. And in tuberculosis, you will be having T for tuberculosis, you will be having transverse ulcer, right? This is the ulcer you have to remember. So flask shape ulcer like this type of ulcer, this is going to be what? This, suppose this is going to be your mucosa, this is going to be your mucosa, this is going to be your submucosa. So you will be having invasion in the submucosa, and this is looking like a flask shape and leading to what? Dysentery also. So this is known as flask shape ulcer. Next question, which helminthic infections commonly transmitted through soil? Very important, through soil, is characterized by the presence of eggs seen in the image below as observed in the stool sample. What kind of eggs are they? They are the eggs, barrel shaped eggs. Are they bile stained or not? Yes, they are bile stained. Yes, that pus is known as what? This pus is known as anchovy sauce pus. Anchovy pus appearance is known as. And here you will be finding what? Trophozoites inside. Since we are taking this thing out of the liver, this is going to have a trophozoite. Anytime you take sample inside the body, you will find trophozoite, which is the active motile form. Cyst is going to be non-motile and non-active form is known as what? Cyst. Okay, so this is going to be what? Trichuris. Trichura, very important, your last exam question. This is also known as whipworm. Whipworm. Ankylostoma and Necator are also known as hookworm. They are together known as what? Hookworm. And remember, these hookworms are going to be what? Here you will be having eggs with blastomere. These eggs are going to have what? Blastomeres. Means segmentations are going to be there like that. Okay, so these are the eggs with the blastomeres, right? Whereas Ascaris, you will be finding what? Male is going to be coiled in the Ascaris, whereas female is going to be what? Straight. Female is going to be what? Straight. And here you can have association with what? Here you can have association with the intussusception also. Intussusception. And it can even lead to your Loeffler syndrome, massive eosinophilia, right? So this is going to be the thing. This is your Trichuris, Trichura. And this Trichuris, Trichura can also lead to what? Iron deficiency anemia. Okay, so this is going to be the Ascaris. You can identify the Ascaris. Who is going to be coiled? Male is going to be muda hua. Male muda hua hoga, right? That is going to be, male is going to be coiled. Whereas female is going to be what? Female is going to be straight. And what about the eggs? The eggs, you need to remember, if they are unorganized, if they are unorganized, this is going to be what? They have asked this question. Unorganized, remember, unfertilized. Organized matlab fertilized. This is going to be organized, this is going to be fertilized. Unorganized means unfertilized egg. Okay, this is going to be the egg of hookworm. This is going to be the eggs with the blastomere. This is going to be the eggs with the, this is the egg of hookworm. This is the egg with blastomere. These segmentations are known as what? Blastomeres. These segmentations are known as what? Blastomeres. And lastly, this is the egg of what? This is the egg of, these are the central hooklets. These are the central hooklets with polar filaments. These are the polar filaments that you can appreciate. So what is going to be your answer? This is going to be the egg of what? This is going to be the egg of, yes, Nana. Kaun sa Nana? Which Nana? H Nana. This is a cystod egg, right? Now tell this question. What is the medication used to treat the infection caused by the cystod egg? What is the medication we are going to use? So what is this egg? Again, central hooklet with polar filament. Here it is written like central hooklets is going to be there. Polar filament is going to be there. And this is going to be a non-bile strand egg, right? This is going to be the egg of H. nana, which is going to be a type of cystod, right? And this is going to be also known as dwarf worm. This is going to be the dwarf worm. Dwarf matlab ye sabse chota hoga, sabse smallest is going to be there, right? So what is going to be the drug of choice here? So remember, we have got three categories here. What are the three categories we are having? In the helminthology, we are going to divide it into three categories. First is going to be what? Platyhelminths or flatyhelminths. Platy or flatty. I call it flatty, right? So platy are going to be the flatworms, right? So what are the two categories we are having in the flatworms? We can have what? Cystodes and we can have what? Trematodes. Cystodes, we have learned 5 organisms in the cystode. If you can recall, we have got what? We have got Diphyllobothrium latum, the first one D latum, second one is H. nana, third one is Echinococcus granulosus, fourth one is Taenia solium, and the fifth one is Taenia saginata. These are the 5 organisms we have seen. And trematodes, we have seen the 4 organisms, important ones. The first one is going to be what? Cystostoma family. Cystostoma family. After that, we have learned about the clonorchis. We have learned about the liver fluke, lung fluke, and basically your clonorchis. We have learned about the Paragonimus westermani. That is going to be the lung fluke, right? And this is going to be the trematodes, right? So for all the cystodes and for all the trematodes, the drug of choice is going to be what, beta? This is going to be praziquintal. The drug of choice for all the cystodes and trematodes, we can use what? This is going to be what? Praziquintal, right? This is your exam question, praziquintal. Earlier they have asked this question, 2018-19. Second question, what are the exceptions we are going to have in cystode? I told you the 5 organisms. I've told you about the cystode. I've told you about the 5 organisms. This is going to be what? One organism is going to be what? Echinococcus granulosus. Echinococcus granulosus, also known as dog tapeworm. And this dog tapeworm is going to cause what? Hydatid, and this is going to get treated with the help of other drugs, not with the praziquantel. Another organism is going to be what? Taenia solium, which is going to cause what? Neurocysticercosis. So this is going to cause what? Hydatid, and this is going to cause what? Neurocysticercosis. For both of them, the drug of choice is going to be what? Albendazole. So for both of them, the drug of choice is going to be what? Albendazole. And here if you talk about the trematodes, we have got only one important one, that is your NEET PG last to last year exam question, that is going to be what? Fasciola hepatica. Fasciola hepatica is also known as the liver fluke, and this Fasciola hepatica, the drug of choice is your exam question. This is going to be your triclabendazole. Triclabendazole was the answer. So this is going to be the triclabendazole we are going to give. For roundworms, majorly we are going to give what? Albendazole, right? So here in this case, the answer is going to be what? Praziquantel, right? Cystod egg is going to be what? Praziquantel. H. nana is given, so answer is going to be what? Praziquantel. Okay. The next thing, an infection with Clonorchis sinensis is associated with the increased risk of what kind of cancer? So what kind of cancer we can appreciate with this particular one? Cervical cancer, remember we have seen for CS cervix is going to be what? HPV 6, 11, 16, 18 were there, right? 6, 11, 16, 18. We have got Cervarix also, we have got Gardasil, right? And we have got nonavalent Gardasil for the vaccination. Cholangiocarcinoma is due to Chinese liver fluke. And that is known as Clonorchis sinensis. The name of this is Clonorchis sinensis, which is a trematode, right? Gastric carcinoma is due to what? Gastric adenocarcinoma can be seen with what? H. pylori, which can also cause what? Maltoma, mucosal associated T cell lymphoma, right? And bladder carcinoma is seen with Cystosoma hematobium. Remember, it has got 3 species. Cystosoma has got 3 people in the family. What are 3 people? First one is going to be hematobium. Second one is going to be Mansi, right? You can remember Cystosoma hematobium. Second one is going to be Mansoni, right? And third one is going to be what? Japonicum. Remember, this hematobium will be having terminal spine, and it can cause what? Terminal hematuria, and it can cause what? Bladder cancer, bladder carcinoma. Whereas Mansi will be having lateral spine. Mansi lat maar degi, you can think like that. So it can cause what? Swimmer's itch, right? This is going to have what kind of spine? Lateral spine. Whereas this Japonicum can be having what? This rudimentary spine. So this can cause what? Katayama fever. This Katayama fever can be seen with Mansoni also. This is Katayama fever. And what kind of spine will be there? Rudimentary spine. So all of them are going to be what? Trematodes. They are coming under the family of trematodes, but still they are not functioning like trematodes, right? So this is going to be exceptional family, Cystostoma family, right? This is going to be the exception we have read, right? So answer in this case is going to be what? Clonorchis sinensis they have asked. So answer is going to be what? The answer is going to be cholangiocarcinoma. Now again, next question. Try to answer this one. Which of the following virus is responsible for this particular presentation? Which virus is responsible for this following presentation? So this is going to be what? This is all herpes we are discussing about. Herpes means what, beta? Herpes means grouped vesicle. I told you herpes means grouped vesicle. Herpes itself has divided into 8 families. We have got alpha viridae, beta viridae, and gamma viridae. HSV1 means above the waist infection. You can have oral herpes, that means also known as cold sore, that is going to have multiple grouped vesicle. Whenever you see multiple grouped vesicle, means clear fluid filled lesion less than 1 centimeter around face, this is going to be oral herpes. Never touch this, right? Second thing, this can enter into your eyes. In ophtha you studied about dendritic ulcer, which is a very beautiful ulcer, you can appreciate. Third thing, it can enter into your brain, it can go to your brain through your eyes, it can go to your brain, and the most important and most lovely place for this particular one is going to be what, temporal lobe. And this thing can cause what, temporal lobe encephalitis, right, which can even lead to damage to your hippocampus, which is responsible for conversion of your short-term memory to long-term memory. So this person can have this herpes infection above the waist. HSV2 is going to cause what kind of ulcers? This is going to be your genital ulcer, beta. Genital ulcer, we have summarized 5 types of genital ulcer we are going to have. Painful is going to be two of them are going to be painful and multiple, whereas painless are going to be what? Exam is near, try to summarize. Painless are going to be what? 2. They are going to be single. Try to answer what are the single ulcer, what are painful and multiple. Remember, herpes you can rule out easily. Herpes means multiple grouped vesicle. Second one is going to be what? Chancroid. In chancroid is due to Haemophilus ducreyi, and they will always give you unilateral lymphadenopathy. Always remember, right-sided inguinal lymphadenopathy, left-sided inguinal lymphadenopathy. I told you the drug of choice for chancroid. Clap. C for chancroid, the drug of choice will be azithromycin, right? Legionella, atypical pneumonia, and P for pertussis. Painless ulcers can be what? Syphilis, right? And second painless is donovenosis. Sir, how to differentiate? Donovenosis is a beefy red ulcer. Beefy red ulcer. So you can easily rule out beefy red ulcer is given. Your answer will be what? Donovenosis. Syphilis is going to be single genital painless ulcer with rubbery or shorty lymph nodes. So they can write you shorty or rubbery lymph nodes. We are done with the ulcers also, right? So this is going to be what? This is going to be HSV2. HSV2. HSV3 is going to be what? This is going to be known as what? Varicella. Varicella. HSV3 is varicella. It can reactivate, that is what is known as varicella zoster, right? So HSV3 is known as varicella, also known as chicken pox, and this chicken pox reactivation is known as what? Herpes zoster. Remember beta, herpes means grouped vesicle, zoster means along a nerve segment. So zoster means along a nerve segment. So when you have multiple grouped vesicle along a nerve segment, that is known as herpes zoster. So here you can appreciate. In chickenpox, you can have this appearance. Pleomorphic rash are going to be there. Multiple morphology of rashes will be there. You can have dewdrop on rose petal appearance. Dewdrop on rose petal appearance. This is also known as what? This is also known as herpes, right? This is going to be HSV 1, 2, 3 coming under the family alpha viridae, and you can do zinc smear for them and you can find multinucleated giant cell, right? Gamma viridae will be having HHV4. HHV4 also known as Epstein-Barr virus can cause what? It can cause multiple cancer. It has got association with multiple cancers, right? It can cause nasopharyngeal carcinoma. It can cause Burkitt lymphoma. African guy that you can see, right, with the jaw picture, that is going to be Burkitt lymphoma. You can have non-Hodgkin's lymphoma. You can have Hodgkin's lymphoma also, right? Nasopharyngeal carcinoma. You can also have oral cancer associations. This is going to be what? This is going to be Epstein-Barr virus, right? HHV5, human herpes virus 5 is known as what? Cytomegalovirus. Cytomegalovirus, right? This is going to have this appearance. This is known as what? Owl eye inclusion bodies. This is going to be what? Owl eye inclusion, right? To look at the virus better, to look at the virus, we use what? Electron microscopy. To look at the inclusion bodies, we can use what? Light microscopy. What are inclusion body? You can have something in the cytoplasm, something in the nucleus, or maybe something in the both cytoplasm and nucleus. That is what is known as inclusion bodies, right? So for to look at the virus, you can use what? Electron microscopy, and viruses will be black and white always. Electron microscopy will give you black and white picture. To look at this particular thing, these things you can appreciate, they are what? Inclusion bodies, right? So this is going to be both intranuclear, intracytoplasmic inclusion body. This is known as what? Cytomegalovirus. HHV 6 and 7 is going to cause what? Exanthum subitum, and HHV 8 was your last exam question, which is also known as what? Kaposi sarcoma, where you will be having this type of lesions on the body, on the mucosa. This is also known as, this is a vascular, this is also known as vascular hemangioma, right? This is a vascular hemangioma, or a vascular lesion that you will be finding association with the HIV, association with certain cancer or immunodeficiency state, right? This is the most common thing you can appreciate. This is going to be HHV8. So in the HHV family, herpes family, you have got 8 members. HHV1 is above the waist, HHV2 is going to be below the waist, HHV3 is going to be what? That is going to be chickenpox, 4 is going to be Epstein-Barr virus, 5th is going to be CMV, 6, 7 is exanthum subitum, and 8 is going to be Kaposi sarcoma, right? Another virus, they are going to give you picture and they are going to ask you in NEET PG, they have given this picture last exam, try to identify the virus. So you have to remember certain points about the viruses and you can identify them very easily, right? GP41, GP120, P70, integrase, reverse transcriptase. What is your answer? The answer is going to be what? These two RNase molecules. You can appreciate these two RNAs. The answer is going to be what? Answer is going to be what? This is going to be what? HIV virus. Simple understanding. GP41 drugs, enfuvirtide, MAHA, all these drugs we are using, reverse transcriptase inhibitors, integrase inhibitors, all these things are going to go in the favor of HIV. What about this particular one? This is going to have a protein. This protein you can appreciate, spike protein. Very important. This spike protein will bind with the ACE2 receptor in the lung, angiotensin converting enzyme receptor in the lungs, and this virus is nothing but your COVID-19. What is this virus? Here you can appreciate the HBsAg antigen, HBc antigen. This is going to be what? This is going to be hepatitis B virus. And this is going to be what? Here you have written what? E6 and E7. That is what you need to remember. Remember, this E6 is going to inhibit P53. Remember the policeman and governor of the genome, right? So P53 is going to be there and RB gene is going to be there. So this E6 is going to inhibit what? P53. This is going to inhibit P53, whereas E7 is going to inhibit what? RB gene. And this virus is known as what? Human papilloma virus, HPV. And this is the strain HPV 16, and you remember 16, 18 is going to cause what? Cancer. This is going to be the cancer which is going to happen because of this HPV, right? CA cervix you can have because of this HPV, right? So these viruses you should be remembering by looking at the picture. You should be able to identify. Now you know what is HHV viruses we are having. The next question we are having is this particular baby which is coming to you. What is the probable diagnosis for a 12-year-old boy? This is a young boy coming to you with the symptoms of fever, ear pain, swallowing problems for the past week, and the examination reveals swollen testicles are there, and this is the picture we are having. Now try to identify. If you're not able to identify, sometimes just try to rule out the options also, right? In the examination, if you are able to rule out one option, your probability for getting the right answer will increase, right? Some of you are marking B, some of you are marking C. So let's try to sum up this particular question. Croup is due to what? Croup, and what presentation you are going to get in croup. Croup is due to a virus, and the name of the virus is going to be what? Para-influenza. Don't confuse it with the influenza. Influenza virus is influenza virus is a different thing. Para-influenza virus is a different thing. Apart from that, you are also having Haemophilus influenza, which is a bacteria, and that bacteria we are having vaccine also, that is Haemophilus influenza B vaccination in the national immunization schedule. Why do we need to have that? Because in children, in adults also, it can cause what problems it can cause. Haemophilus influenza B can cause meningitis, you can have epiglottitis, you can have pneumonia, you can have sinusitis, multiple problems, otitis, right? So that is the reason we are having what? Haemophilus influenza B vaccine, which is a bacteria. Influenza is a virus that is going to cause what? Flu, and this para-influenza is going to cause what? Croup, right? And in croup, what sign you will be finding? Shabash, very good. This is going to be known as what? Steeple sign. This steeple sign is going to be there. Where do you find the thumb sign? Thumb sign is going to be seen where? Where do you find thumb sign? What happens in the mumps? Mumps, the most common presentation you can have, that is given here, right? You can have what? Patient can have what? Bilateral parotitis can be there. Parotitis. Patient can also have what? Patient can also have unilateral involvement of testes or oophorytis. testicular involvement or oophorytis can be there. Very good. That is going to be what? Epiglottitis, right? So that is going to be what? Mumps, right? In rubella, what are the things you are going to have? You can have Forsheimer spot written in the rubella question. Forsheimer spots, right? Around the uvula you will be having what kind of spots? Around the uvula you will be having Forsheimer spots, and on the body of the baby you can have what kind of rash? This is known as blueberry muffin rash. Muffin rash Blueberry muffin rash, right? That is going to be for the measles, sorry, that is going to be for the rubella. For measles, what is going to have? Measles patient will be having what? Coplic spots, beta. Measles patients will be having what? Coplic spots. And remember, this measles baby is going to die because of pneumonia. And what kind of pneumonia? That is known as the giant cells are going to be there, and those giant cells are known as Warden-Finkelday giant cells. And this Warden-Finkelday giant cells will cause a pneumonia, and that pneumonia is known as H pneumonia or giant cell pneumonia, and that is the pneumonia which can lead to death of the patient. Measles, right? You can have cough, coryza, all symptoms are going to be there, but this is going to be important. Measles, right? What is the strain? You can also recall strains. What is the strain for measles? That is going to be Edmonston-Zagreb. What is the strain we are going to use for this mumps? This is going to be what? Zerilin, right? And what is the strain you are going to use for rubella? This is going to be what? RA27/3, right? RA27/3. So this is going to be the picture you are going to get in the measles, mumps, rubella. Remember, earlier we used to have MMR, measles, mumps, rubella vaccine. Now we are having measles and rubella MR vaccine. Why we have removed this mumps? Because it is not going to cause mortality in the patient, but it can lead to sterility in the patient. You can appreciate testes and ovaries are involved, right? So it can lead to sterility, but sterility is something which is not going to kill the patient. So they have removed the mumps, right? Now we are having measles and rubella because they can be deadly. Person can die. Any vaccine that you see in your national immunization schedule is going to be very, very important. The reason being, they are saving lots of people from the diseases, right? So that is the thing we are having. So this is going to be what? Mumps. Next question, what could be the likely diagnosis for a COVID-19 patient who initially presented with fever? Patient is having fever, nasal congestion is there, and headache is there, and later developed facial pain, numbness, and blackish kind of discharge coming. On SDA, as soon as you see SDA, what you should be appreciating, SDA means fungus. Cotton wool, very simple, right? Non-septate hyphae, right angle, obtuse angle, no need to even talk about it. This is going to be direct answer. This is going to be what? This is your mucormycosis. Let's try to understand what is this mucormycosis. We have already seen this black colored nasal marks is coming, right? What kind of lesions will be there? This is going to have obtuse angle, right? Septate or aseptate hyphae. So aseptate hyphae will be there. This is going to be aspergillus, where you will be having what? Septate hyphae will be there. In aspergillus you will be having what? Septate hyphae will be there, right? So this is going to be the thing. What is the drug of choice for us? This particular is voriconazole, and here we have already discussed, right? Next question. 43-year-old female patient presented to OPD with the symptoms of fever, headache, joint pain, petechial rash is going to be there, and bleeding from the gums. Her profile says hemoglobin is 9, WBC 3000, and platelet count is 22,000. What is your diagnosis? What is your diagnosis? Yes, this is a short case. Simply it is written, this is going to be a case of, in scrub typhus we have seen there will be a black color scar should be there. Remember, all the rickettsial infection will be having what? Fever, pain, lymphadenopathy, right? All the symptoms are going to be similar, right? Here also you will be finding one more extra thing that is going to be at the site. You can have what? Black scar. Typhoid we have already seen, malaria we have already seen, that means fever with chills should be there. this arthralgia, myalgia are going to be what, not very specific symptoms. So this is going to be going for the like in the favor of dengue, right? In the dengue you can have what, decrease in the platelet count, and here the platelet count is already given, that is going to be what, 22,000. This is going to be a case of dengue. What is going to be the treatment? Drug of choice for dengue is going to be what? Drug of choice for dengue is going to be what? So this is going to be what? Symptomatic treatment. Symptomatic treatment. There is no drug of choice in viral infections. Symptomatic treatment is something we are going to give. If they give you question of fruit bat, you have to think about what? Nipah virus. What is the treatment? Symptomatic treatment. If they give you chick sign, there is hyperpigmentation on the nose, you have to think about what? Chikungunya, right? Or we will have another session for this on the Telegram where we will be discussing about this treatment. Remember what? Symptomatic beta. Symptomatic means you have to give what? Water to the patient, water or hydration to the patient. This is something. Look here, we have got blood beta. Blood has got two component. We have got cells, we have got plasma. Last concept I want to convey here, right? Cells will be three types: RBC, WBC and platelets. These are going to be comprising of 40%, whereas plasma is going to be 55% or 60%, let's say, right? This is going to have what? This is going to have everything else like fresh frozen plasma, cryoprecipitate, okay, 4-factor complex, everything will be in this side. This patient is having deficiency of what? Platelet. This patient is having deficiency of platelet. You want to treat this patient with the platelet only. Here you are not going to use fresh frozen plasma, not going to use 4-factor complex, cryoprecipitate, plasma, nothing is going to be working. Only the thing which will work is going to be platelets. And we have got two types of platelets. We have got RDP, random donor platelet. We have got single donor platelet, right? RDP means multiple people are donating, that is going to be platelet. Okay, RDP will increase the platelet count by 10,000, 1 unit, and SDP 1 unit will increase the platelet count by 30,000, right? So this is what you need to remember. Hydration plus platelet is the ultimate treatment beta. Okay, you got the concept, right? This is going to be for the day, right? So with this we are done with the session, right? I've just tried to keep the most of the things very concise as much as possible. And remember guys, the exam is approaching very soon, right? Only 10 days are left for the examination. Every minute is going to be important, right? A river cuts through a rock not because of its power but because of its persistence. This is the last time. Do not give up. Do not give up in any situation. Just try to keep doing the things what I have seen over the years, right? People who are consistent are going to do the things, are going to pass the examination. Okay, there are miracles which are going to happen, and they really happen, right? You can join me on my Telegram group, my Instagram, or maybe you can see for other rapid revisions, short and crisp rapid revisions on YouTube available. You can join there and you can see it over there, right? I would be putting some questions, keyword questions in my Telegram group before the examination. Along with that, I will also make you understand how to appear for the examination, because that is also going to be an art, right? So for that particular thing, you can join me, right? Thank you so much for all the patience, and keep doing the hard work, guys, right? And make sure you get your sleep schedule right. This is the ultimate advice that I can give you, right? All right, thank you so much for all the patience. See you